You can start, sir.
We can start now. So, welcome all on behalf of DIGIShield, Thane Psychiatric Society, and Mastermind Thane. I would like to introduce Dr. Vedhas Nimkar, who is a convener and moderator for today's webinar. He is a MD physician. He is a consultant physician working with Dr. Nimkar Clinic and Jupiter Hospital, Thane. He is a renowned speaker, expert speaker on COVID vaccine, and conducted over 25 COVID master classes. He was also convener of a COVID Experts Conclave 2021. He is the first physician to conduct a COVID awareness program for general public in March 2020 and COVID expert speaker on various national and regional television channels. So over to Dr. Vedhas Nimkar sir to start the sessions of today's with eminent speakers and for delegates. Over to you, Dr. Vedhas Nimkar sir.
Thank you, Dipanji. Very warm welcome to all our delegates, our colleagues, senior colleagues and friends. Today, we are starting with a novel new program. The title is COVID-19 from Loss to Gain. We all know that last 2 years of this pandemic have really taken a lot of toll on not just our physical health, but to a large extent on our mental health as well. In various talks that I keep arranging, it has been your demand, the audiences, that they would want to know from the experts in the psychology and mental health about how to cope up with this. So that was the whole idea behind this. And this is a joint academic initiative of DIGIShield, Thane Psychiatric Society, and Insight Mind Care Center, Thane. We have three very eminent speakers. I am short of words to describe their achievements today, talking on various topics. And today's program has been designed jointly by me and Dr. Shailesh Umate from Insight Mind Care Center, Thane, who's the organizing chairperson for today's program. He's also our panelist. So now, without wasting further time, let me not come between you and the eminent speakers. We'll start off with our first lecture by Dr. Ashish Deshpande sir. His topic is Doctors as Addicts, and the chairpersons for this lecture are Dr. Omkar Mate, renowned psychiatrist from Thane, and Dr. Nilesh Basarkar from Thane. I would request Dr. Mate sir and Dr. Basarkar sir to be seated on the virtual dais, and I would request Dr. Mate sir to introduce our esteemed speaker, Dr. Deshpande sir. Over to you, Dr. Mate sir.
Good morning, everyone. Am I audible?
Yes, very well.
Yeah. Thank you, Insight and DigiShield, to invite me as a chairperson today. I'm really short of words to introduce Ashish Deshpande sir, but I'll try to do the job in few sentences. Sir has been a consultant psychiatrist with more than 25 years of professional experience and has been the recipient of Hinduja Foundation Scholarship, Indian Association of Retired Persons Scholarship, and YD Phadke Scholarship for Community Mental Health. He has been the past president of Bombay Psychiatric Society and is a life fellow of Indian Psychiatric Society. Sir has been working on the developmental theory-based comprehensive school counseling program, which has reached more than 6,000 students, and community-level de-addiction services throughout the country. He takes great interest in familiarizing the world with mental health by using the print and electronic media, and his episode in Satyameva Jayate on alcohol abuse has been one of the most celebrated effort of his. So with our recent we are collaborating with sir and his CM Hearts Foundation as I am a Rotarian, so Rotary is collaborating with sir, and we are conducting a one of its kind initiative where there will be three verticals in de-addiction involving the community, schools, as well as the healthcare professionals. So without further ado, I hand over the mic to sir. Please enlighten us.
Thank you, Omkar.
Today's topic, addiction in physicians. It is like talking about addiction, malaria in physicians. The signs and symptoms remain the same, outcomes remain the same. Understanding of the disease does not really change the prognosis of any disease just because we are physicians. So I'll be talking about various addictions that lure the world. Most of us are aware of the substance addictions, but some of you might be aware of internet addiction disorder or gaming disorder or the age-old pathological gambling, and something that is increasing in our part of the world, that is pornography. You might be surprised that pornography is a $25 billion industry, 3 times bigger than Hollywood, and the largest consumer of pornography in the world is our own country. So I'll be talking about behavioral addictions as well as substance use addictions. All these addictions also happen in physicians. So these are 3 real life cases that I have seen, and all 3 were wanting something that they were not liking. They certainly did not like what they were doing, but they couldn't control their want and they kept on doing something. So case 1, he was a 43-year-old associate professor orthopedic surgeon from level B city in India. When he came to me, he was already in a mental hospital for 25 days, and he had received 8 ECTs. He was nearly on 8 to 10 medicines, and he was absolutely confused. He was an associate professor in orthopedic, and when he came to me, he introduced himself as a resident doctor in doing dermatology. He did not know whether he was married, whether he said that in fact he was unmarried, and forget about the children part. Prior to admission, there was history of alcohol consumption since residency. Problem alcohol drinking. Very soon after residency, friends and parents noticed that he was consuming excessively. Since 5 to 6 years, he started having manic symptoms, and there was associated social deterioration, wrong decision making. And in that manic episode, he was admitted in a psychiatric nursing home. So the manic episode and consumption of alcohol continued. A diagnosis of alcohol-induced manic disorder was made, and I thought it was iatrogenic delirium. We just had to taper the medicines. He was given nutritional supplementation, nootropics, and mood stabilizers, and within 3 weeks, he was absolutely all right. He knew which city he came from. He remembered his wife. He was missing his children. He had insight into his psychiatric illness, though he did not have memory for whatever that happened, the way he was brought to the mental hospital in Mumbai from the city of his living. But he remembered the times that he started living in a rehabilitation center where I was associated. Though he had the insight in his psychiatric illness, he did not have insight in his alcohol use disorder. He said, I am a responsible specialist doctor. I come from a devout Hindu family. I want to be progressive. There is no family history. I work hard and play hard. And alcohol is better than your sleeping tablets. Because he was not aware of what was happening with his substance use, he did not accept any of the treatment that I had to offer to him. He was discharged because there was no change and no readiness to accept any kind of treatment. 4 to 6 months he was okay, and again he started drinking. Again he had manic episode. This cycle of readmission, denial and recurrence continued. He was certainly not liking what was happening, but could not stop wanting it. He lost his job, he lost his family, and lost his respect also. A 28-year-old female physiotherapist who came to a metro to study. She was tomboyish, and like most of the tomboyish girls have difficulty in making friends, during school days there were severe social adjustment issues. She came to Mumbai for education, but probably she wanted to escape from the rural setting that she was living in. Once she came to Mumbai, she wanted to be accepted. She wanted to be around people, so-called fun people. She wanted to please those so-called fun people, so she started consuming what they were doing. Cigarettes, weed, started coming in first as recreational, then stress buster after exams, before exams. Thought that it was a friendly thing to do. She got many friends with ease and with benefits also. When she was referred to me by a gynecologist because she had vaginal sepsis. Diagnosis of cannabis use disorder with depression and high risk behaviors with medical complications. She was detoxified at home because her withdrawals were not very severe. She realized that there was something wrong with cannabis use. She realized that after taking cannabis, she starts taking a lot of risks she later on feels bad about. She was sober for 2-3 months, but she had extreme guilt of her behavior, shame, because all her college friends knew what had happened to her. At the same time, she was disconnected from her family and she had no connection whatsoever with her school friends. There was embarrassment and loneliness. Non-acceptance by immediate relations, stigma, taboo, fears. Along with that, there was anger with gender-biased society. The need to accept her behavior as a child was unfulfilled. And now, in a metro also, she was accepted only by people who were taking advantage of her. The rebellious attitude, the confusion about gender equality, she had attempts to fill her loneliness by risks. And one of the part of taking the risk was consuming the substance. So again, she was involved in relapse, guilt, shame, loneliness cycle, again ending in a relapse. She was certainly not liking what was happening, but she too could not stop it. Third case is of a pathologist, a son of a philanthropic doctor couple. He was introduced to pornography in college days and was associated with masturbation while watching pornography. Initially, it was less frequent, but somewhere around 2000, when he had his first mobile phone, the masturbation and pornography access improved. Surprisingly, it became hard porn later on, even during exams, after exams, when he started his practice from his father's clinic. At home, in between patients, he started watching violent porn, incest porn, started spending nearly 2 to 3 hours a day on pornography, and on holidays, he would spend even 6 hours. He was exhausted, tired, and embarrassed because he started fantasizing about his own mother, his sister. One of the solutions offered was get him married. So he got married, but he had erectile dysfunction with his partner. So he started abusing sildenafil and tadalafil. The marriage issues came up because the wife came to know about his pornography. And of course, the erectile dysfunction also did not help. He was tired of masturbation, guilt of erectile dysfunction. He was confused about his own fantasies, the violence involved in sexual fantasies, rape and bleeding. He did not know what superstimulants are, but the ease of access, wherever he was, there was a computer, and internet ready. He was understanding that his habit was becoming uncontrollable and unmanageable. The frequent relapses kept on happening. He was depressed. He too was not liking what was happening, but could not stop wanting. After a few years of going through these repeated relapses, he attempted suicide. So, what these three individuals who did not like what they were doing but continued to do, they all came from our own society, and all of them were physicians. They probably, we all know that they might have some genetic issues, but apart from that, they were born in a society. They were nurtured in a family. So there were some developmental issues, the social issues. There was exposure which led them to repeat that exposure, whether it was a substance or a behavior or an experience, they kept on repeating that experience. And for that experience to come to their life repeatedly, there were some social circumstances. Maybe suppressed sexuality, maybe non-acceptance of a particular behavior in some person, or maybe feeling that too much orthodoxy is not good for a particular person. Depending upon whatever social consequences or circumstances that they were born in, they started developing an internal thinking. Those constructs started defining their individuality, their identity, their acceptance, and concepts about experiences. The feeling that they could control whatever that they were doing. The social influences by repetition were getting converted into biological, and then the body responses happened. And those body responses had neurobiological consequences. And these are the consequences that we study in neurology or neuropsychiatry. So deficits in DOPA, maybe 5-hydroxytryptamine transporter locator protein, allele response, mu-opioid, whatever it is. So the social influences led to biological changes which led to socio-biological phenomena, and these socio-biological phenomena were responsible for the problems that they were facing. So we know that there is a genetic vulnerability which fills up the glass that I am showing on the right hand side. Add to it social permissiveness in the society, ease of availability, individual circumstances, information available to the individual to make a choice, the soft skills, hard skills, coping skills that they have, and age of brain exposure. So when all these things come together in an individual, then you have a disease state. So it is rare to have an addiction unless all these things come together. So what it tells me is that having addictions is rare, and some information about the disease itself is likely to protect, probably likely to keep us away from the disease. The age of brain exposure, if you have it above the age of 21, information available to the individual to make a choice, and coping skills. So it just tells me prevention is very much possible. So for any person, to prevent an addiction is easier than treating it. So let's come to the biological aspect of addiction, the last column in the previous slide. So our brain is like a cricket ground, the pitch being the IQ. So if the IQ is not too good, then the optimization of function may not happen, will not happen. The bowling tracks are the emotional intelligence. So if the bowling tracks are affected, the match is unlikely to happen depending upon the severity of emotional affection. But most of the diseases of the brain are like having wet patches somewhere in the fielding area. So for instance, if the third man has a wet patch, then the fielder who is fielding at third man is the person who has to take care. If he goes into the wet part, he is going to slip and he is going to have an injury, or the match is going to stop temporarily. Something similar happens in the brain. For a long time, in addictive disorders, we did not know where exactly the wet patch is. So for instance, in diabetes, we know it's in pancreas. But in addiction, where is the wet patch? Now we know that if you poke a pin just above my eye and above my ear, where the pins are likely to meet, that is the area called ventral tegmental area and nuclear accumbens area, or the mesolimbic structures are the ones which are affected in addiction. So you can see these colored threads indicating the various neurotransmitters involved. So what happens in addiction is there is an exposure. The exposure is enjoyed, and that's the reason why it is repeated. And when it is repeated, there is a reason. Because with every exposure, there is increase in the dopaminergic neurotransmitters in the prefrontal cortex. The prefrontal cortex dopaminergic levels are directly proportional to the serum levels of the psychoactive substance. So whenever the dopaminergic levels go up, when the serum levels or the effect of the behavioral experience dies down, the dopaminergic levels also come down. And that's the reason people are probably confused, because they feel that, okay, the intoxication part is over and my brain is as it was before. What they don't understand is that in the ventral tegmental area, there are certain glutamatergic changes that are happening that neither the person is aware nor can you observe it from outside. So I'll give an example like, okay, you make a pav bhaji and you know that you have made it for 5 people, you have to increase it for 10 people. So whether you have added the potatoes to increase the amount, by just visual inspection you will know. But whether you have added salt or not, you will not know. So something similar happens. The dopaminergic increments are visible like potato in pav bhaji, but salt is not visible like glutamate in addiction. What happens with glutamatergic changes is that with every exposure, the glutamate keeps increasing. Imagine a situation where with every increment, if the salt keeps increasing, the pav bhaji is going to be salty. And the only way you can correct it is by adding potatoes. So in an addicted brain, the glutamates have increased to a certain level, the brain has become salty, the brain starts demanding dopaminergic inputs. So what happens is with the first exposure, there are changes in the glutamatergic system that the person and his surroundings are not aware of. Because he enjoys the experience, he keeps consuming. Then he learns that consuming is good, not consuming has a withdrawal effect. So to avoid that, he keeps consuming. Repeated exposures keep on adding the glutamatergic weight. So the balance becomes glutamate heavy. The dopaminergic increments are required. And when the dopaminergic increments happen, there are compulsive changes in whatever that is happening. Now the system has gone out of control of the individual. So if the changes are permanent, then do they get well? Yes, of course. So this complex diagram that I am showing is about what happens with self when he is born in the world and his actions. So the id, ego, superego is now biologically converted into distributed adaptive control theory. The controls happen at the somatic level, the reactive level, adaptive level, and the contextual level. And in addiction of any sort, whether it is behavior or it is substance, there are alterations in the reactive and adaptive controls. So when alterations happen, the adaptive functions become less important, the reactive functions become very, very dominant. And that is the reason why the person starts reacting impulsively, reacting emotionally, making short-term choices, and that is where the relapses happen. And in that, the 12-step program becomes important because it creates a world, it alters the internal state and shapes the action. Any of our therapies is not able to do all these three things together. And that is the reason September 2020, Cochrane review says that 12-step programs are better than any of the treatment modalities that we have. So how does one treat? Stop the addictive experience, treat the withdrawals, apply differential susceptibility to addictive experience model, understand the warning sign, dispositions, factors, create support groups, coping skills, and explain importance of staying stopped and not just stopping the drug. It can be done from the home, hospital, rehabilitation center. There are certain scales, tests that we can use in order to help us formulate the differential susceptibility to addictive experience model. Manualized 12-step program facilitation and 12-step program are the hallmarks of a good treatment outcome and continued motivational enhancement. Readiness to quit and change is like a pendulum. From on one end, it is pre-contemplation stage where the person doesn't accept that he has a problem. On the other side, there is complete acceptance and readiness to change. Programs and policies for changing the world that we live in are as important. Huge effort and awareness is required, and creating readiness in societies to address addictions is essential. So as Omkar was saying, what are we doing with SWIMARTS? We are collaborating with Rotary Action Group Addiction Prevention in India and we are trying to create a thrust area all over the country. We have constituted a National Scientific Committee Addiction Prevention, and we are trying to develop capacities of treatment providers with a program which is approved by NSCAP. We are affiliated with NIMANS, Regional De-Addiction Centers, Indian Psychiatric Society, Indian Medical Association. We are trying to cater to 7 municipalities, a population of 1.2 crores. The School Connect is the program that connects us to the school children and implement the evidence-based interventions for preventing addictions. Health Connect is for healthcare workers, Community Connect is to reaching out to communities, Corporate Connect, and Research Connect. We have a research wing in this particular project. So we create local expertise to deal with addiction. So we have created 4 treatment teams in Thana district. We are creating supportive communities who would help these expert teams in order to implement the programs. The impact of the program will be monitored through technology. Local community leaders will be created. Their role, mental health professionals' role in the community leadership will be cemented and advance towards community coalitions and pressure groups which will demand certain evidence-based policies to be implemented. Now, how has COVID-19 affected mental health physicians? So the way we can look at it is that all of us know what has happened to new medical entrants and students with exams getting postponed, not knowing what is going to happen. Finally, the Supreme Court has given its directive and we have something moving. But the students who are enrolled in MBBS courses, they are hardly having any ward experience. There are hardly any lectures being conducted. Even if they are conducted, most of them are online. And the offline lectures are very difficult to attend because of COVID appropriate norms. The family physicians have been affected a lot because they are the pillars of the healthcare system in COVID times. Many of them have had exposures and many of them, because of fear, they have stopped their practice. The resident doctors of various specialties are not getting the experience that they need to get in the 3 years of their study. Their whole focus is on the entrance exams for their super specialties. In many of the tertiary hospitals, the super specialty clinics are going on reasonably well. Specialists in early careers, they are finding it extremely difficult to set their practice because patients are not coming up for treatment for the fear of reaching to the hospital and contacting information. Specialists in mid careers are having financial crisis because they have taken loans and they are not able to repay because the practice is down. Specialists in late careers, when physicians usually start really making good money after the age of 45. But if they have difficulties in sustaining their practice because of fears or because of lockdowns that are happening, it is affecting their projections about their careers. Young doctors, their marriages have been postponed. Parenting has affected. No time before COVID, the parents have started spending so much time with their children, and sometimes that too also can be very difficult for kids and the parents to tackle. Urban doctors and rural doctors have a different way of coping. The rural doctors, because of the open spaces that they have, seem to be affected little less. People who are in job and in private practice have shown different kinds of affections. Anxiety disorders, OCDs, depressions with DSH tendencies, psychosomatic disorders, disorders of initiation and maintenance of sleep, and of course addictive disorders of all kinds, not only substances, but with behavioral experiences also have increased. At the end, let me quote Sant Kabir with CMARTS and De-Addiction Connect, the project that we are doing with Rotary. I believe that jin खोजा तीन पहिया गहरे पानी पैठ मैं बपुरा बुड़न रहा डरा रहा किनारे बैठ. I prefer to jump into the water. I don't know whether I will get anything out of it or not, but I don't want to be the one who is sitting on the banks. The art is not what you see, but what you make others see. That's what Edgar Degas said. So De-Addiction Connect is an art of helping addicts and alcoholics to see hope. If you are interested, you can connect with us and join our program. This is the Facebook page, this is the email address, and this is the WhatsApp number. Thank you.
What an insightful thought, Dr. Deshpande sir. I mean, amazing, really amazing. Dr. Omkar, you would want to ask sir something?
Yes, sir. Sir, that was an excellent talk. Any particular case where you came across in behavioral addictions or addictive disorders after post-COVID in physicians?
Yeah, all these. Immediately after post-COVID?
Post-COVID, after post-COVID, as in like after the lockdown, especially.
Yeah. There are multiple relapses that happen, and it can happen in physicians as well as non-physicians. Because let me tell you that about mental health, physicians, all non-mental health physicians are lay people. Okay, there are very few doctors who know exactly what mental health care is. Okay, and as I have not prescribed an antibiotic for the last 25 years, none of the physicians have prescribed antidepressants. They should not be. Okay, but so my knowledge of antibiotics and their knowledge of antidepressants, I would put them together. Okay, so for me, all non-mental health professionals are lay people when it comes to mental health.
Well said, sir. Because it's a fact. I mean, out of shame or out of perhaps thinking that we are ourselves doctors, so we can handle it. Many times, actually, doctors they keep neglecting their own mental health issues, and that's the whole purpose of arranging these webinars, where our doctor friends, colleagues can get help if they choose so, they can anonymously seek help. There are some helplines also which have been started for doctors.
Dr. Nimkar, I have an objection with the word psychological illnesses also.
Okay.
Because the heart is in the body, the bone is in the body, the pancreas are in the body. So all the problems are physical.
Yes.
So my question is whether the brain is in the body or outside the body.
No, it's very much in the body.
So then why do we require it to be called with a different name?
Absolutely.
So I think all problems are physical. There is nothing like psychological.
Yeah, that's a valid point, sir. So on that note, we are going to take more questions for you, sir, from the audience also in a later segment. I would like to call upon Piyush. Piyush, if you could please bring up the virtual memento for sir, and I would request Dr. Omkar and Dr. Nilesh to present it to Dr. Deshpande, sir. Piyush, if you could show it on the full screen.
Yes, sir. A moment, please. Dr. Ashish's memento.
Dr. Ashish Deshpande, sir. Yeah. Dr. Deshpande, sir, and Dr. Omkar, sir, and Dr. Nilesh, sir, please present it to Deshpande, sir, virtually.
Yes. Please accept it as a mark of our gratitude, sir, for an excellent presentation today.
Thank you, sir. It was a nice presentation. Thank you.
I would request you to give memento to Dr. Omkar and Dr. Nilesh as well. And I would request Dr. Shailesh Umate, sir, our organizing chair for today, to present it to Dr. Omkar and Dr. Nilesh.
Omkar and Nilesh, thank you so much.
Thank
you
sir.
for gracing this occasion.
Thank you, sir.
And it was
Thank you.
wonderful. Yeah, thank you so much.
Thank you.
That we will move on to our next esteemed speaker. Our next speaker is Dr. Rajendra Barve, sir, and his topic is Mind Your Stress Mindfully, for you need it the most. And the chairpersons for this particular talk are Dr. Sanjay Kumawat, sir, who's an eminent psychiatrist in Thane and Mulund. He's also a panelist for the later segment, and Dr. Prasad Shetty, sir, an eminent psychiatrist. I would request Dr. Prasad Shetty, sir, and Dr. Kumawat, sir, to kindly be in the virtual chair. And Dr. Prasad Shetty, sir, if you could introduce Dr. Barve.
Thank you, Dr. Nimkar, and thank you first of all for having me here. Good morning, Dr. Barve, sir.
Good morning.
Good morning. Sir, I
The handsome young man.
No, thank you.
Dr. Rajendra Barve, senior psychiatrist, Mumbai, is known to everyone. However, I'll introduce you in short. Sir is well known for his literary skills. I know that very well. Sir has published a book. He's very active in social media and always there to help you when you require him. And he's been the chairperson, coordinator in many CMEs. And sir is very active on mindfulness in his Facebook page, and social media is very active, and he dissipates a lot of information. And sir, the insight which you give in this social media sites is very encouraging and very useful. And this is precisely in line with your topic today. So sir, without much ado, I'll request you to take over and give a presentation.
Thank you. Thank you very much, Dr. Umate, Dr. Shetty. I can see Dr. Shubha Thatte ma'am and Dr. Vedhas. I can't see everyone, but I'm very happy to be here on Sunday morning, when it's actually we should be mindfully spending with ourselves, but rather than doing that, we are with our colleagues and talking about something which actually causes a lot of stress to us. So, but it is good that we are gathered here. This kind of a camaraderie also is a wonderful stress buster for all of us. I heard the last comment about where is the mind, and why there should be a separate discipline called psychological medicine or psychiatry, since brain is inside the body. Okay, but right now I think everything has suddenly become virtual. There is neither brain nor body. There is nothing. There is only virtual reality, and all of us are existing in a virtual reality. So, so what we are doing is actually not anything physical, not anything mental. It is just in the virtual world that we are existing, and this virtual world has made tremendous difference to the science of mindfulness. Uh, the word mindfulness, I would straight jump into what I would like to speak today. May I know I have about 30 minutes to speak. Am I right, Dr. Umate? Okay, okay. See, the word mindfulness is kind of a new entrant into the medical world, into the so-called evidence-based psychiatry or evidence-based medicine. But the word mindfulness was introduced in 1885 by a Scottish man called Rhys Davies. Now, Rhys Davies is the one who translated the Tipitaka, the 3 canons of Buddha's thoughts, into English. And that was the first time the English speaking, the Western world, and unfortunately, the elite Indian world also got introduced to Buddha's ideas. It was all in Pali. It was preserved very beautifully in Chinese, in China, in Sri Lanka, in original Pali language. Most of it was rehearsed, said again and again. And finally, it was written 500 to 600 years after Buddha. So what we have is very well said. And I always start by saying that in most of the scriptures, it's a evam me sutam, evam me sutam. That means everybody says that this is what I've heard. This is what Buddha said, evam me sutam. This is what we have heard. So it's not that we are not vouching for it, we just said that this is what Tathagata Buddha said. So the word mindfulness itself is a translation of a Pali word called sammasati. Now, why I'm spending a little more time on this, essentially because the word mindfulness doesn't fully bring into the picture what is actually meant by sammasati. Sammasati is part of the 8 noble path. This is the 7th step, so-called 7th step. It doesn't go in a stepwise manner, but it's the 7th step that Buddha talked about. And this is the 4th noble truth. This is the 4th noble truth. And this 7th step of the 8 noble path, of the 8 steps of the noble path. And every step starts with a samma, or in Sanskrit, it is samyak. Now, what Buddha said is not completely brought into the word mindfulness, and that's why I want to spend a little more time in it. What actually he meant was samyak. Samyak is comprehensive, wholesome, complete, and the right one. So all the 8 paths were the right ones, they're comprehensive, they were inclusive. So once you say it is inclusive, wholesome, it means something which is not generally quickly thought of is brought into the whole scenario of the 8-fold path. And what was brought in? A very important thing. The right, one translation of samyak is right. So what is right? What did he actually perhaps mean? Is that every step that you take is based on compassion. It is based on the knowledge of what you're doing. You are aware of your knowledge, and you are also the knowledge which is connected to the community. So it's not just being aware of yourself, but being aware of everything that's happening around you with what? With compassion. So this word compassion is not completely embraced in the word mindful. So there are many such translative errors from the Buddhist text. Another word which I'm going to use, and which is something which created all the revolution about mindfulness, which was called dukkha. Okay, my sound is low. Okay, okay. Okay, the word dukkha, okay, it may be slightly better now. Okay, the word dukkha is in Sanskrit is dukkha, in Pali it becomes dukkha, kakha, so it becomes dukkha, which was translated as suffering. Now, if you read the Pali text very carefully, if you read the Abhidhamma carefully, you will realize it's not just suffering. Any kind of discomfort, any kind of dissatisfaction that one feels is called dukkha. Very, very important, because it becomes more, again, becomes very comprehensive. It's not related to only, it's not related only to feeling sad or feeling or suffering. So it broadens the view of mindfulness. Now, mindfulness was kind of not being cared for. It was only Heidegger, the existentialist, talked about mindfulness, because the existentialists come rather close to it. Jung didn't talk about it, Freud didn't talk about it, but some of the free association that you talk about when Freud talks about free association, it comes rather close to being uncensored, listening to what the client is saying. And that uncensored being is part of the mindfulness, the definition of mindfulness. So for many years, mindfulness was not being attended to by people. It was only later on, late 60s, that there was sudden surge of interest in Buddhist or Eastern philosophy, as many people traveled, the academics traveled to Eastern part of the world. They came to India, they came to Thailand, they went to Sri Lanka, they went to Burma, and you know the story of S.N. Goenka Guruji, who traveled from Burma to India and established Vipassana centers all over India as well as all over the world. So this kind of resurgence of interest in what Buddha taught. And some of these people who were wandering in search of truth and peace, something like, you know, what Siddhartha Gautam did in 2,600 years back. They came and they studied from Ajahn Brahma, that's Acharya Brahma, who was there in Thailand, in Sri Lanka, and then they went back. Some of them were actually robed monks. They disrobed themselves, went into academics, and one such person was John Kabat-Zinn, who was not robed, but was highly impressed with the idea of mindfulness. It was only around 79-80 that in the Massachusetts General Hospital and in the Institute, they said, we have some people who suffer from anxiety, or they're suffering from deeper pain, and they're very, very disturbed people. We have given all kinds of medication to them, but they don't seem to respond well. Why don't you take them up for your meditation? There was resistance for John Kabat-Zinn to actually register for meditation for his PhD. Anyway, but then he started working on these people, bunch of people. He trained them for 8 weeks. He also included yoga as part of mindfulness. I lectured them, taught them, and slowly evolved the definition of mindfulness, which I'll say in the next couple of minutes. The result of these, the trial that was done was very stunning. The people came out and they said that and the pain was, you know, the pain was sometimes with cancer, arthritis, the intractable pain kind of. They came back and said, look, what has happened to us is not that our pain has reduced. It has indeed reduced to 25 to 30%. But what has changed is we are no more suffering from pain. That means the pain which was there, we are reacting to that pain in a different way. And that led to a very clear definition of mindfulness. That means what was described as dissatisfaction of some reality, in Buddha's words, came out very strongly, and they used the word suffering. Perhaps that's why it got stuck to that word mindfulness. And what were they doing? And what was taught to them in mindfulness is very relevant to us, because the first and primary work on mindfulness was done by John Kabat-Zinn, was on stress reduction for the pain patients. And it defined mindfulness as paying attention with purpose on the present moment, without judgment, without criticism, as if the life depended on this moment. That means it was so crucial that you have to remain present in that present moment. The words are very important. It's paying attention to the present moment without judgment. What was said in mindfulness was that you need to see things the way they are, not through your filter of judgment, through your filter of censor, through your filter of criticism, what it should be and what it is not. So this creates lots of anger, angst, discomfort within people. Like this pain people describe, oh, I'm so angry that I have this pain. I'm so upset that I have this pain. And our anxious patients, many times they say, I'm so anxious that I'm anxious. I'm so depressed that I'm depressed. I'm so sad that I'm sad. All this is recognized as metacognitions. So when you pay attention to the actual experience, the metacognitions seem to pass away because you are becoming non-judgmental. So paying attention on purpose. What is the purpose? To know the truth. So one of the Rinpoche says, every time you practice mindfulness, you are discovering truth for yourself. Exactly like how Buddha discovered truth for himself, that the basic truth was, the first noble truth was the dukkha, that it is eternal part of life. And how did you create that dukkha was also explained. So this was the first thing that was done, is mindfulness-based stress reduction. And the word was very important, reduction. It's not elimination, it was reduction. Why? Because the primary experience may remain, but you are no more reacting. This goes very close to what Viktor Frankl said, that between stimulus and reaction, you are, that is your consciousness. It passes through your consciousness, that you are aware of it, and you have a choice to make how to react to it. So Viktor Frankl comes very close in his logotherapy also when he defined it as that. But in mindfulness, what happens is that it's not paying attention on the present moment just for paying attention. It is to understand and develop deeper insight into what are the contents of the mind. So many times when I'm talking about mindfulness, people ask me a question, if you're going to empty out the mind, what are you talking about mindfulness? So the answer is very simple. The answer is that you don't want to empty out your mind, but you just want to listen to all the chatter that goes on, all the clutter that is accumulated in the mind. And you've got to see it as a witness, as something that is a phenomena that occurs within the mind. These are 4 stages of mindfulness. That you are aware of your breath, that you are aware of your body scan meditation, and also aware of the contents of the mind. And how are they created? By the 5 senses that you have, and they create that reaction in your mind. You perceive it as pain, then you react to that pain. And then you are mindful of your mindful. Am I aware? I'm checking, am I aware that I'm aware? So another way of describing mindfulness is going back to the word samma sati. Sati means shruti. Shruti means what you have heard. Like evam me sutam. That's why I introduced evam me sutam. Shruti. Shruti is what? Gathering knowledge. So when I said the comprehensive meaning of samma sati is being aware of the knowledge that lies deep inside you, and also that knowledge comes in with compassion. So Shruti became Sati, and this is how you remember. You remember to remember. Remember that you are aware. Remember that you are breathing. So that's a paying attention with purpose of remembering. It's like your child. I remember my mother when we took me to guests, to people as guests. She'll say, "Remember, you are in somebody else's house." So that was the remember you're somebody else's house is perhaps a remnant of mindfulness. Maybe my earliest lesson in mindfulness that came very intuitively from my mother. Now that was in 79, 80 story, but mindfulness became a buzzword and has become now what is known as Mac mindfulness. It has traveled almost everywhere, and essentially thanks to this the technology which evolved after that with MRI scan, functional MRI, PET scans, CT scans, which could actually slice the brain when people were alive, they could really see and they could really understand what is meant by neuroplasticity, which is kind of created by mindfulness. They could see how different parts of the brain were functioning in mindful states. And for that, they used two things. Number one, they used monks who had practiced mindfulness for a very long time. So they scanned their brains to find out how their brain is functioning. And they found different ways. It was much different than the rest of the people. Then they started using the same scans for people who were undergoing mindfulness. And all these results are there. All these papers are scientific papers are there. I don't want to spend about, you can just go on Google Scholar and type neuroscience and mindfulness and you'll be showered with papers. But sum and substance of it is that they found few things. Number one is the amygdala, which we know as the hub center, which actually perceives emotions and perceptions and projects it to the prefrontal cortex. That seems to be rather bigger, swollen, and in mindfulness, it kind of shrinks. That means it becomes less functional and no more disturbs the prefrontal cortex because it doesn't send so many impulses saying that, well, there is pain here, pain there, pain here, pain there, etc. So they found shrinking of the amygdala. Second, they also found change in the anterior and posterior cingulate gyrus. Anterior cingulate gyrus is more about paying attention, the posterior more about wandering mind. So these two words become very important. Paying attention really strengthened the anterior cingulate gyrus, and also the posterior cingulate gyrus was paying attention into the present moment. That means you stop wandering. And the mind tends to wander because that's what the default mode of functioning. And it just wanders in the past and the future. And the stress is not what you experience now. Stress is what you experience, what has happened in the past and what may happen to the future. And I'm basically talking about MBSR, mindfulness, as applied here in stress, because applied in many psychotherapeutic applications. We have action commitment therapy, you have DBTs, then Teasdale work on mindfulness-based cognitive therapies, so on and so forth. But for us as doctors, we need it essentially because we are undergoing tremendous stress. Actually, I believe most of the physicians and practicing doctors, we are reaching a state of burnout, essentially because we have worked with great compassion, we have worked very hard, and ability to respond with compassion is, I guess, is coming down. And that is why some of us are withdrawing, not only essentially because of fear, but we feel so tired, exhausted. As my own story also, I can say. So for us as physicians, as doctors, for us, it's very important to be mindful of what's happening. So this comes to the next stage of what are the contents of the mind. Very simply put, sensations within the body, which we tend to ignore, okay, as physicians. Doctors, because doctors are known to be not very good patients. Sensations, impulses which come immediately, maybe anger, maybe frustration, maybe just feeling fed up, or feeling very angry, or disgusted, depressed. It could be also different kinds of feelings that we are talking about. The impulse of anger, feeling of anxiety, feeling of depression. There are many thoughts which are mood congruent, which are basically, we know that since mindfulness based is used in cognitive therapy, we know that the cognitions are very important, the thoughts are very important, which are distracting us, which are taking us back either in the past, or they're pushing us into the future. So it's a mind wandering, essentially, is with the holding the thought, either it pulls you back or takes you ahead. And also different kinds of images that we create. I remember once I gave a talk in Dombivli, I think, and there was a speech by another doctor who talked about the medico-legal aspects and different kinds of things that may go wrong with doctors. And I opened my talk by saying that maybe all of us, when we're listening to him, I don't recollect the name, maybe when we were listening to him, I at least found myself behind bars because somebody had complained. That image was disturbing me a lot and really couldn't focus what my dear friend was saying. This is what happens to every one of us. These images, these situations we tend to create. This is true for patients, this is true for doctors. So this is the emergent phenomena of the mind. And what do we do? So we go back to mindfulness, go back to Buddha's ideas. Three important things. Dukkha is the eternal truth. That's a noble truth. That's the reality of life. Because noble word has been now retranslated as realities, 4 realities of life. Number 1, that is the reality of life, that there is dukkha, there is dissatisfaction, there is discomfort because of various things. What causes it, we really don't know. It's like I give an example of a funnel, which is an open mouth, many things, but it finally passes through the brain and leaves, and the residue is left in the sieve, and the pain, the discomfort goes deep inside in the body as well as in the mind. So this is what is happening with in the noble truth, that this is the reality, and this is from where it originates. And also said that it is possible to get rid of it or possible to let it go. So an important aspect which I want to bring into mindfulness is dukkha as the first lakshana. Second is the anitya. That means everything that emerges has a very short lifespan. It is only a khanik, it is only for a moment, because we know for sure it's all a game of the neuroendocrinal system, how the steroids come up and the adrenaline comes, it reaches a point and disappears slowly. So it's a anitya, it is the anicca of the experience that you go through. And the last one is anatta, about which we won't talk much because it's more metaphysical in nature, because if everything that comprises of us, mind, body, everything is changing every moment, then where am I? What is my called swa? Main kahan hu? Main kaun hu? That becomes a huge question, but that's a metaphysical question. We'll not get into this. We essentially want to talk about the temporariness, the impermanence of these emotions, of these thoughts. And this appeals to us because we know that in obsessive disorders, patients come back and say, yes, ye vichar mere man se nikalta hi nahi hai, jata hi nahi hai. And we keep on saying that it will pass only because you are holding it, it stays. If you ignore it, it passes. So that is the truth. And many times the Rinpoches and some of the monks talk about, Sich, who passed away last night, always talked about mind as being a beautiful ocean. And all the waves on the top are the emotions and the thoughts which keep on coming and going, But the ocean, the mind stays, in the sense it is there. That's the reality. And that is what really constitutes. You need to ignore the waves which come and go. So this anityatva, this anicca is a very important aspect. And this is what was taught to people who suffered from pain. And they said this is a pain and you're reacting to it. And your reaction can be anicca. Your reaction can come and pass. And they were surprised when their metacognitions seemed to taking backseat. The basic cognition also reduced significantly. So this is the story of mindfulness. Then there are many evidence-based meditative work which is part of mindfulness. And the important aspect is that mindfulness or meditation or mindful meditation, which was part basically of faith, which was basically so-called religious idea of only being driven by a mantra, was brought to evidence-based medical practice and became practice which can be evaluated, which can be scientifically studied. And that is what mindfulness is in the current state of mind. Let me give you my personal experience. When I had my attack of COVID Delta, I had severe problem in deglutition. I couldn't swallow my spit. I couldn't swallow anything, not a drop of water. And I said to myself, this is the moment of truth for me. This is the pain moment for me. How am I reacting to it? How do I want to react to it? And there came a moment when I said, I want to look at my pain and say that my reaction to this pain is going to pass. And lo and behold, it was kind of a miracle that I can say that the pain did not reduce, but I could swallow. I could swallow because while swallowing a drop of water, a sip of water, I just said, the pain that I'm going to experience now is there, but I'm reacting to it. And because I'm reacting, my pharyngeal muscles are constricting and making things worse. So let me not react. And the pain persisted, but I could overcome some of the problems. That was a very personal experience that I had been teaching mindfulness. So I said, this is my opportunity to practice it in a very challenging situation. So it really helped me, and I have been practicing mindfulness because mindfulness is something that is, the awareness is there, something which is all the time. It's not that I'm sitting for meditation that I have this experience. I'm aware of what is happening inside me all the time. So it's a very interesting say, because when I went for Vipassana, many people go for Vipassana, they give a break and they say, do your chankraman. That means you do mindful walk. When you're walking, you're walking. You're fully attending to your body sensations of walking. When you're eating, you're eating. This is what Buddha said. What do you do, guys? Do there in your place when you gather and have your sermons. Say, no, when we are eating, we are eating. We are sleeping, we are sleeping. We are walking, we are walking. We are fully present in the present moment. So mindful meditation becomes very, very important because it gives a different opportunity to apply. Because if you are aware, you are also aware of all the craving that happens. And the craving is, we know that craving reaches a sharp peak and then it is going to wear off. But we don't wait for the wearing off. We just capture the craving moment and we get into the whatever that you want to take in. It may be gambling, it may be a substance, it may be watching something, it may be porn, anything. Not realizing that this is a moment which is going to pass. So you just hold yourself back and look at it, you will see it is passing. It's like a wave which rises and falls away, moves away. That is how mindfulness is being applied in psychiatry. It is being applied in various other branches. So very interestingly, in 2005, the British Parliament, the conservative lot, sahibs, they said, we heard this mindfulness is like a crazy wave coming from US. We want to know more about it. So they created a white paper on it, and they said that, well, it seems to be making tremendous sense. Essentially because it's highly economical, because practically no side effects. It can be taught by not necessarily only psychiatrists, it can be taught by psychologists, counselors, even NHS practitioners have been trained for about a year in mindfulness, and they're teaching mindfulness. And they spread it across, and they said it's useful, mindfulness useful, because stress is everywhere, in doctors, in patients, it is there in organizations, it's there in correcting institutes, it's there in military, it is in the schools and educational institutes, because children can't focus. People are suffering from stress. In military, people suffer from post-traumatic stress disorder. Veterans are suffering. In corrective institutes, they are the victims of the craving that happens. So why not take it? And they're spreading it, and it's like a fire. Now, I did say that practically no side effects, but anyone who has been to Vipassana, you know, the third, fourth day, your silence is broken because someone around you is always crying, always letting it out, crying very, very bitterly. Why? And some of them want to leave, and some of them leave also. Some psychotic people who come in a psychotic state, they really can't handle the silence. They can't handle so many things suddenly emerging, that mental phenomena that I talked about, they simply can't handle it. So it's not one thing fits all. We need to screen who are imminent highly depressed or psychotic really can't take vipassana or even can't practice mindfulness because they are not, their ego strength is not adequate to handle the silence or handle the emergent phenomena of the mind, the sensations, the images, the intensity, the impulses, the thoughts and feelings. They can't handle it. So we leave them aside. Second objection which has come is that this is simplified, it just simplified. And they call it Mac mindfulness because they simplified everything. They just wrapped it up in a beautiful cover and just hand it over to me. Hey, come on, it's not that difficult. You just sit and take a long deep breath and it's over. So there is a criticism which is coming from all quarters. New York Times recently published an article that's creating zombies out of people, essentially because people have not understood what is meant by mindfulness. So there are many responses of this kind, and they want to wash it away by saying that mindfulness is not something which is scientific and cannot be used for everyone. Partly true. So we can put away mindfulness. But there is one new research, which not new, the research which is coming out talking about why does it, how does it happen? And this is come when you try, when I teach mindfulness, I focus only, basically focus on breathing, because that's the first anapana meditation. Focus on your breath, the way it comes in and goes out. Just follow your breath, not finding out whether it is right or wrong, enough or not enough, whether it's the right way to do it, wrong way to do it. Is this the way this is what was taught to me? No, just they're all judgments. So get rid of all those judgments and just remain focused on the breath. That it comes in and it goes out. The first step of mindful meditation is breath meditation. That becomes the stepping stone. And many people can stop there. It's fine because it's very close to what Gita, in Gita it says, sparshan krutva bahirbahyan chakshuched antare bhruvo pranapano samam krutva nasabhyantara charinam. So finally, when Arjun says, what do I do? Please tell me. So he says, sparshan krutva, just leave everything out. Free your prefrontal cortex, which is right behind your eyebrows. And pranapana samam krutva nasab, just experience the movement of the air, that way it comes in and goes through your body. Yeah, that is the mindful meditation. The second body scan meditation is being studied in more details now. And there is the kind of flurry of activity of training the vagus nerve. And we know that vagus is predominantly parasympathetic activity, induces parasympathetic activity right from everywhere it goes. Mostly it is parasympathetic. It goes right up to the gut, it goes right up to the mesentery, it goes up right up the colon. It spreads everywhere. So it's called vagus. It's a vagabond nerve. It starts from the midbrain and reaches everywhere. And body scan meditation, second step of mindfulness, is all about becoming aware of the body sensations, which are not only physical sensations, but the internal body sensations. And that is how the parasympathetic system perhaps is taking over the sympathetic system. And that is why a big thing is happening now is train your vagus, and many apps on train your vagus. But the truth is that vagus is what really is going to help you in the body scan meditation. So that will be basically, we're getting very close. As psychiatry students, we're taught Jacobson's muscle relaxation, we're taught meditation, and this is something close to it. The tracks are parallel, but mindfulness is much more than mere relaxation. Mindfulness is understanding not the tranquility, but not getting attached to the tranquility. It also gives yet another insight into how the mind functions. Because you teach mindful meditation or teach meditation to anyone and suppose, but sir, I can't concentrate, my mind wanders, it goes here and there, I sit here, next minute it jumps out of my mind and my thoughts jump out and go elsewhere. Very, very true. But in mindful meditation, one thing is told is that moment, very important, very, very important, I think underlined, is moment you become aware that right now you are mindless. That means your mind is wandering. That's the moment when you catch mindfulness. And how do you catch it? Very gently. Be very compassionate, I talked about. Be very compassionate with yourself and gently call back. It's like building your biceps. It's like more repetitions, it works. When you start, you simply can't do it and you say it's really painful, I don't want to do it, give up. That's why people give up gym after the 4th, 5th or 10th, 15th day, because it becomes painful, it becomes very difficult. But the more repetitions you do, better you are. So when moment you become aware that your mind is wandering, just gently प्यार से बुलाओ बेटा वापस आ जाओ. किसको बुलाएंगे? खुद के माइंड को बोलेंगे कि बस be focused on the breath and be here this moment. Another part of mindfulness which I would, depending on how much time do I have, few minutes more.
Yeah,
Sure, sir.
Okay.
You can take your own time.
Go ahead, sir. Go ahead.
Go ahead, sir,
Okay,
please.
okay. So another way of teaching mindfulness is very, very simple method. Is I teach and taught everywhere in the world, and many mindfulness trainers start with belly breathing. And it's very interesting. Belly breathing we know for sure, and this is how I explain to my clients, my students whom I teach mindful meditation. So when you're breathing, when you're focused on your breathing, you are not really focused. You can't really remain focused on the breath. You need to add something else to it. And the breath that you use by your intercostal muscles, it's just enough for you. But when you use belly breathing, when you use diaphragmatic breathing, you are bringing something more to your breath than just breath. And you bring something more to your breath, your ability to remain focused on the breath is much better. So teach belly breathing. Ask people to stand up. When you breathe in, let the abdominal wall come forward. When you breathe out, let it be pulled in. So it's a very beautiful, this is how the babies breathe. I mean, you see their belly going up and down, belly breathing. So abdominal wall pulled in, abdominal wall goes out. You can practice this lying down. Abdominal wall goes up, abdominal wall comes down, and you remain focused on the movement. So it kind of the Anapana meditation also brings in Kaya Anupassana. That means it also brings in body scan. That means you are more aware of your body also. So you could go a little one step ahead and they become aware of the way their body breathes, the way their respiratory system works. And one more thing, the belly breathing becomes very, very important essentially because we know for sure that breathing out is basically a parasympathetic activity. And when you belly breathe, what are you doing essentially is you are strengthening the parasympathetic activity so that it takes over the sympathetic activity. The tone is slightly, it becomes unbalanced, goes towards parasympathetic system, and parasympathetic system does the beautiful word that you say, calm and connect. Beautifully said. It calms you down. We know for sure, calms down because sympathetic activity is the pressing the button and the stress button. Adrenaline, steroid, jump in. Parasympathetic is the one which says calm down, calm down, calm down, calm and connect. Beautiful. Calm and connect. Connect to what? Connect to self and connect to compassion. You become, when you are calm, you can look out because when you are in stressed condition, you are completely withdrawn within yourself and within the pain, not aware of the pain, but suffering from the pain. So how does mindfulness comes in? When you are unaware, you are disconnected. Your mind is disconnected from the outside world. It loses its charm, it loses its knowledge. You are not aware, and we know for sure, "Arey yaar, wo time main bhul gaya," because I was not aware, I was not there. My mind was elsewhere. My mind was where? My mind was under stress because it was working on that sympathetic system. So moment I become aware, what happens is that I connect. And when I connect, I can calm down. Because then I know that moment I start looking at it, the intensity goes up. And this is how I teach. Ask people to be in, say, in a traffic situation, and they just give them suggestions that you are in traffic, you are jam-packed vehicles, you hear the horn, the screaming vehicles, someone sitting next to you screaming, you are upset, and you become aware you are holding the steering wheel very tightly, your eyebrows are furrowed, and you are very worried about what's going to happen next. Then I take them out and I tell them, look at this traffic from the 25th floor, from a tower. Look down and see. And all of them come out and say, now we see vehicles. Our body was not so tight. I was relaxed. I could feel my breath. And the last important thing they say is that when I was looking at it, in traffic, I was stuck. And when I looked at the traffic from tower, I could see that the signal, which seemed to be unending, was not as unending. The vehicles moved, and I could see constant flow of the vehicles. So in that state, is you see the constant movement of vehicles. This is exactly in mindful meditation you experience, is that the thoughts, the feelings, they come and like waves and they seem to be passing. And this is what the observation or the witnessing of the mind, that is the emergent phenomenon of the mind, is like a traffic that keeps on moving. Some old vehicles, some old thoughts, some new thoughts, some brand new, some like cycles, some like motorcycles, etc., etc. They're constantly there and constantly disturbing us. So this ability to get away from that experience and observe it, it's called the witnessing. Now, we are very, very elite audience. So it goes back to what? It becomes very interesting. This is what I'm studying right now. This goes very close to what is described as a Turiya Avastha. Turiya Avastha is the one which is not you are awake, you are sleeping, you are in deep sleep. And the fourth stage of human mind, according to Vedanta, is Turiya Avastha, where you are actually, you are not there. You are not conscious, you are not sleeping, you are not deep sleep. You are observing yourself. So you're witnessing yourself. So there are, kind of tracks are parallel. The track which is basically prescribed by Vedantins talks about the Turiya Avastha, being able to witness it. Perhaps they stop there. And second thing is that the deeper insight of the anityata is not so much emphasized there. I'm just bringing few thoughts which I have, random thoughts. So they don't bring in the anityata. They don't bring in the dukkha concept. That's why mindful meditation becomes more insightful, because it gives you a deeper insight. Something like, in CBT, the person says, oh, I know this is what catches me. This is that bloody irrational thought. I want to dispute it. So that kind of insight is very, very beautiful. Third thing about mindful meditation, which is again emphasized by most, is that once I did one for Rikshida, I was doing this mindful meditation for the Women Psychiatrists Association, and they said, oh, we practice and say, oh, we feel so calm. Oh, I felt so tranquil. I said, oh my God, that's very frightening. Because the moment you say it was very nice, it was tranquil, it was wonderful, you already created a craving that you want to more and more. I want to be in that tranquil state all the time, which is not possible. That tranquil state is also momentary in nature. So if you crave for tranquility, again, you are in trouble. So idea is that seeing the phenomena of the mental experience, which is very important. Seeing the phenomena, emergent phenomena of the mind. That is mindful meditation, which is different than concentration meditation. Secondly, two things also, the emotional dysregulation, which is something with which everyone is struggling. We are struggling, patients are struggling. That changes essentially because of the amygdala change. So that dysregulation comes down significantly, and it's like you're constantly trained to pay attention to the breath. That also trains your attention. So by and large, what you're working on is your default state of mind, which is basically can be wandering, and it's trained to remain task focused on the breath. So you're playing with your own brain and training it. That's how the neuroplasticity steps into the picture. So my friends, mindful meditation is what we need very badly. We as doctors, as physicians, as psychologists, working in this field very badly, because right now our own minds are tired, exhausted, burnout, or under stress. And we need to have that breath, which is going to soothe us, which is going to make us feel calm and connect to, firstly, to ourselves, then to the community. And finally, the mindful meditation, where does it lead? Where does it ultimately lead? This was described by Buddha as the Brahma Vihar. This is a final stage where you are practicing mindful meditation. You've done it very well. And where do you reach? Just described in 4 words: Metta, Karuna, Upekha, and Mudita. Metta is friendliness. I talked about the being connected to people. Metta, that is Maitri or Dosti. Karuna is compassion. Upekha, that is Upeksha, being equanimous, of being able to see Sukha Dukkhe Same Krutva Labha Labha Ujaya Jayu. That sense of withdrawal, being able to see the mental phenomena of what is happening. Okay. Seeing that mental phenomena. And lastly, mudita, the sense of blissfulness that you can experience. The sense of mudita. Mudita is blissfulness, anand, because Satchit Ananda. That kind of the true nature of self is not anything else but the blissful state. So 4 things it leads to: metta, karuna, upekha, and mudita. But it's like reaching towards that, and we are going step by step. And even if you manage to do anapana meditation regularly, it works. Last thing, a lot of research is being done. You just go on Google Scholar and you get plenty of things which I'm not talking about. They're too complex. I'll have to use slides which I don't like to use. Secondly, one of the very important papers which say the Americans are very good at it. They say how many hours you really have to do it, because there was a big myth created by that everything has to be done 10,000 hours, then only it is possible. So they say no, that's very difficult, because there are monks who had done it for 15,000, and this Matthew Ricard is supposed to be the happiest monk because he has got huge store of dopamine. That was how he is described, the happiest monk. But anyway, so this is the what is minimum period required. So they said minimum period required is about 15 to 20 minutes regularly for 8 weeks can start kindle neuroplasticity. Now it has come down to what? 3 breaths, 5 breaths. Today morning I heard 1 single breath. Idea is what is 1 single breath? Just bringing your mind from what is happening around to this moment. This is the moment that I'm breathing. This moment I'm breathing. I'm alive, experience life as this breath. So I think, okay. So I think this is what I wanted to say. If there are questions, I would love to answer.
Thank you, Dr. Barve sir, for you so beautifully elucidated this concept of mindfulness and tracing its roots to the Pali canons, to its spiritual connotations associated, to the present times, where how beautifully you told that how it is integral to the modern evidence-based psychiatry. That was beautiful. I would like to thank you for sharing this mesmerizing talk with us. And I hope all have felt enlightened today, as we say. Uh, I'm sure audience has a lot of questions for you. We'll take them in the next session after the third speech is over together in the panel discussion. I would like to request Piyush to bring up the virtual memento for sir, and I would request Dr. Prasad Shetty sir to present it virtually to Dr. Rajendra Barve sir.
Sir, please accept it virtually.
Thank you. Thank you.
Thanks for the
Accept it.
lucid presentation.
Thank you. Thank you, sir.
And I would also request Piyush to present mementos to Dr. Prasad Shetty. I would request Dr. Shailesh Umate sir to kindly present it to Dr. Shetty.
Shetty sir, thank you for gracing the occasion. Thank you so much.
Thank you, Harish. Thank you, Dr. Piyush.
And I would request the esteemed audience to please put your questions in the chat box. Whatever you may have, we'll take it up. We will move on to our third esteemed speaker for today. He's none other than Dr. Harish Shetty, and he's going to share with us about waves of COVID and ways of coping. I would like to request Dr. Anagha Vaze and Dr. Amol Bhusare to be in the chair as chairpersons. And I would request Dr. Anagha Vaze to kindly introduce Dr. Harish Shetty.
Good afternoon to all. Dr. Harish Shetty is a very well-known psychiatrist from Mumbai and really needs no formal introduction. The Times of India does not publish its daily paper without mentioning his name. A psychiatrist who is an expert in all social causes related to our field, be it education, disasters, cyber psychology, and many others. Through the last 2 years, we've heard him extensively on different media platforms on the effects of the pandemic and its mental health aspects. Who better to have with us today on this topic? A warm welcome to you, Dr. Harish Shetty, and we are all very eager to hear you.
Thank you, Anaga. And sorry for the delays, and heard a little part of Metta from Rajendra. I practice Vipassana also.
Thank you.
Anapana.
Yes.
At least Anapana, if not Vipassana. And I'm happy to hear that one breath is enough. आनंद झाला ते ऐकून. आणि क्या है ये waves of COVID और waves of learning में अपन 2 वर्ल्ड वॉर जीता है. वेव नंबर 1, वेव नंबर 2. वेव 3 अभी आया है और कभी कभी थोड़ा भी थ्रोट में थोड़ा कुछ हुआ तो आई शपथ अबॉटचा सेल्फ टेस्टिंग किट हातात घेऊन आम्ही चेक करतो, पण काही पॉझिटिव्ह अजून आलेला नाही. तर असं म्हणायचं आहे की ॲज ऑफ नाउ सो फार 2 battles won, 3rd battle on. अभी वायरस ने पूरा जिंदगी का डीएनए चेंज कर दिया. पूरा म्हणजे संपूर्ण चेंज करून टाकलं त्या लोकांनी. आज मी ठरवलंय इंग्लिश मध्ये नाही बोलणार. का? मूड आहे माझा, काही कारण नाही. आणि डीएनए चेंज केलं म्हणजे काय? हॉस्पिटलमध्ये जाताना सडनली इन द लास्ट 3 years पेशंट आर आस्किंग हाऊ आर यू, हाऊ आर यू. मला का म्हणून इनिशियली आय वॉज व्हेरी इरिटेटेड. राग आला मला. हाऊ आर यू म्हणजे काय? मला काय नाही झालंय. पण आता थोडंफार आनंद वाटतो. त्या दिवशी हॉस्पिटलमध्ये जेव्हा मी शिरलो, दूरून हाक मारला पेशंट, डॉक्टर साहब, आणि ते पळून आला. कैसे हैं आप? हम आए हैं दूसरे हार्ट डॉक्टर के पास, हम अच्छे, पर आप कैसे हैं? मैंने बोला मैं ठीक हूं. तो ये स्वभाव पेशेंट्स में चेंज हुआ. इसका मतलब दुनिया में चेंज हुआ है, ज्यादातर सब में नहीं. तो ये जो बात है कि जब सबको लगी कि अपना विकेट उड़ने वाला है, आई एम एक अनाउंसमेंट में आ सकता है कि इट्स वी सैडली अनाउंस द डिमाइस. आता है ना, अपना भी एक दिन आएगा, सबका आने वाला है ना. वेदास IMA का आता है ना, IMA और AMC का. आफ्टर दैट फियर ह्यूमन बीइंग्स हैव रियलाइज्ड आपुलकी वाढवणं हे सगळ्यात मोठं इम्युनिटीसाठी चांगलं एक्सरसाइज आहे. When I say DNA has changed, which means honestly, COVID is equal to 1 million workshops on mental health. आपण बोलताय विपासना कर, योगा कर, प्रैक्टिस कम कर, थोड़ा खेल, थोड़ा पिक्चर देख, ये कुछ शिरता नहीं डॉक्टर के दिमाग में. एक ओपीडी पण दूसरा ओपीडी से थर्ड ओपीडी, भागम भाग. कोविड ने सब हजारों मिलियंस ऑफ वर्कशॉप्स विद वन वायरस. तारे जमीन पर जब आया था तो हमें लगा कि लर्निंग डिसेबिलिटी के हजारों वर्कशॉप एक पिक्चर ने बनाया. सो दिस इज वन ऑफ द मोस्ट बिगेस्ट चेंजेस एंड दिस इज वन ऑफ द मोस्ट वेलकम साइड इफेक्ट्स ऑफ द इन्फेक्शन. A lot of things have changed. Doctors who have never shared their PPTs are saying हम PPT सबको देने के लिए तैयार है. डॉक्टर्स बड़े बड़े अस्पताल में, डॉक्टर्स लिफ्ट्स में आरएमओ के साथ बात नहीं करते थे, अभी आरएमओ को हेलो बोलते हैं, खाना खिलाते हैं. हायरार्की ब्रेक हुआ है. आरएमओ उसको फोन करके बोलते हैं कुछ भी हुआ तो मैं हूं तुम्हारे लिए. अरे यार, ये कोई साइकेट्रिस्ट के वर्कशॉप से नहीं हुआ है. ये कोविड वायरस ने एक ही झटके में, इनविजिबल वायरस ने डीएनए को चेंज किया. एंड व्हेन आई से दिस, आई एम नॉट सेइंग एवरीथिंग इज पॉजिटिव. लॉट ऑफ नेगेटिव्स आर आल्सो देयर. Other day, my security guard in my hospital said, Chaube, both his sons are in the army. He said, साहब एक बहुत बड़ा बदलाव आया है. पहले हम सबको गुड मॉर्निंग बोलते थे, साहब लोगों वो सीधा चल के जाते थे, अभी हमको भी गुड मॉर्निंग बोलने लगे. And that is the change which has happened. The vegetable vendor, when he gives you the vegetables, many of them inquire about our families and the way we also inquire about their families. And that, I think, is one of the biggest change that has happened. Compassion, understanding, connectedness has improved with one shot. And that is something that should last. And when I say this, I would also want to say that the virus has mutated for the worst. Let us mutate for the best. म्हणजे काय करायचं? म्हणजे आरामात प्रॅक्टिस करायचं, पेशंटला वेळ द्यायचं. बाहेर पेशंट ओरडलं, आत आल्यानंतर वेळ दिलं तर पेशंट पुन्हा शांत होतो. चांगलं झालं आम्ही एवढं वेळ थांबलं, पण आत आल्यानंतर साहेबांनी आमच्या बरोबर व्हेरी व्हेरी डिटेल्ड इन्क्वायरी करून आम्हाला पाठवलं. आम्हाला आवडलं. आणि म्युटेट फॉर द बेस्ट मीन्स व्हॉट? सिम्पल, slow and steady, appreciating small things in life from your own family, appreciating small things in life from your neighbors. Achanak, when I give my baggage of garbage to my cleaner on the door, suddenly I find people are greeting each other from the neighboring houses much more than what they are doing. Many doctors have given a lot of donations after COVID. But remember, DNA change झालं आणि आम्ही म्युटेट होतो याचा अर्थ असा नाही. Some doctors came to me and said, आम्ही प्रॅक्टिस बंद करतो, बस झालं. किती प्रॅक्टिस करणार? आम्हाला वाटतं सगळं एका संस्थाला पैसे द्यायला पाहिजे. Excessive altruism is exaggerated altruism is illness. So when you are mindful, when you are giving and you are mindful and you do vipassana yoga or any other forms of meditation, Shambhavi Mahamudra, Kriya, Shunya or Tibetan meditation, remember the balance has to be intact. This existential thought of जीवन का क्या अर्थ है, ये भी आने लगा है. When I say man mutates for the best, जीवनाचा काय अर्थ आहे? काय हर्निया करत तोच हर्निया, तोच अपेंडिक्स, आणि आयसीयू मध्ये काय करायचं तोच इन्फेक्शन, तो हेपरिन द्यायचं आणि ते सगळं. People have said they want to leave everything, and I told them this is the smashan virag which happens in one of the communities in India. Suddenly people want to become priests, and you see people on a silver chariot, and then they realize that whatever they have been doing is not appropriate. So a lot of behaviors have changed around us, and let us acknowledge all those behaviors. Let us acknowledge all the good behaviors and negatively reinforce all the bad behaviors. And what are the bad behaviors? अपने को सीधा जाने का बाप किधर? मालदीव्स में, उत्तरांचल. अरे भाई कलसुबाई पार्क में जाओ ना, अपना सह्याद्री में. अच्छा कलसुबाई पार्क है, 6 बजे निकला तो शाम को आ सकता है. नहीं, अपने को डायरेक्ट उत्तरांचल जाना है, मालदीव जाना है, अपने को दूर जाना है. काय को रे? My dear friends, sudden release from the cage after a lockdown is very dangerous. लॉकडाऊनचं दार उघडलं तर हल्लू 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 बाहेर जायचं, योगा करून आनापान करून हल्लू हल्लू बाहेर जायचं, हल्लू हल्लू खायचं आणि हल्लू हल्लू सगळं करायचं, पण हल्लू हल्लू करा सगळं. आणि सो डोंट रश हिअर अँड देअर, जस्ट वॉक अक्रॉस युअर हाऊस, आउटसाइड द हाऊस, फील द ब्रीज इफ यू हॅव नॉट फेल्ट द ब्रीज, and do things around yourself, do things around, not in the periphery of a small semicircle or a circle. And that means mutating for the best. Many doctors have increased the salaries of their drivers. साला पहला एक 100 रुपया 1000 रुपया ज्यादा मांगता तो देने के लिए रोता था, 1000 रुपया ने क्या हाफ कंसल्टेशन, अभी बिंदास देता है. मैंने भी मेरा ड्राइवर का बच्चे का फीस दे दिया अचानक. काय को virus has mutated for the best, let us for the worst, let us mutate for the best. So this change, this DNA change in the soul of human beings is something very fresh, very refreshing, very joyous, and that is something we need to preserve, reinforce, write, talk about, and actually last. My dear friends, knowledge leads to arrogance, wisdom leads to humility. वही तो मैं कह रहा था ना, जो रोज काम करते हैं उसको हैबिट बोलते हैं, हैबिट से जो सीखते हैं उसको एक्सपीरियंस बोलते हैं. मैं ये स्लाइड सबको दूंगा यार शैलेश, लिखने की आवश्यकता नहीं, ले ले यार, जी ले यार, अपना जिंदगी जी ले. वो बोलते हैं ना दिल वाले दुल्हनिया में सिमरन जा, अपने जिंदगी जी ले शैलेश, ले ले. तो नॉलेज लीड्स टू एरोगेंस, विजडम लीड्स टू ह्यूमिलिटी. अरे यार रोज जो काम करते हैं उसको हैबिट बोलते हैं. काय झालं, रुटीन होतं. 4 स्किझोफ्रेनिया, 5 डिप्रेशन, 3 PTSD आणि 4 एन्झायटी, रुटीन होतं. पण जेव्हा इंटरेस्ट घेतो तेव्हा रुटीन असतं. त्या स्किझोफ्रेनियामध्ये सिम्पटम्स वेगळे होते, त्या PTSD मध्ये सिम्पटम्स वेगळे होते. प्रसाद ऐकत आहे. आणि म्हणजे when you are interested, you become wise. So doing the same thing again and again is habit. Learning from habit is experience, and learning from experience is wisdom. तो माह कसम बोलता हूँ, आड़ा टेढ़ा बात करने वाला 5 स्टार हॉस्पिटल के भी कंसल्टेंट्स नरम हो गए. फोन उठाते हैं बॉस, उनका रेजिडेंट डॉक्टर को फोन करने की आवश्यकता नहीं होती, खुद फोन उठाते हैं. मैं आश्चर्यचकित हुआ. एक को पूछा मैंने, यार तू बदल गया यार. मालूम नहीं कैसा बदला, पर बदला हूँ. सो नॉलेज लीड्स टू एरोगेंस. काय का नॉलेज, नॉलेज यानी क्या यार, 1200 ग्राम में है जो पढ़ा है. एंड वी आर फॉर्चुनेट दैट वी आर एजुकेटेड. It is kainat that we are educated. Even we have made an effort, but it is kainat. It was the universe which helped us to get educated. It's not destiny that we are educated, and suddenly अपने को लगता है कि ये सब knowledge सिर्फ काम करने. वो knowledge जो है ना, वो दूध जैसा होता है. दूध से छाछ बनता है, उसके बाद लोणी बनती है, उसके बाद एसेंस बनता है, घी, wisdom. So lot of people come and tell me single sentences. Remdesivir मेरे पिताजी को दिया था, उससे उसका जिंदगी बदला. They don't say रेमडेसिविर दिया उसके बाद इंप्रूव हुआ. See the words people talk. रेमडेसिविर दिया उसके बाद जिंदगी बदला. मेरे पिताजी के तो डॉक्टर सचमुच बहुत अच्छा आदमी है. They don't say he's अच्छा डॉक्टर, they say अच्छा आदमी. So the gap of understanding of the person across also has changed. We look at the wisdom of the person. We also reinforce the fact that it's not only about the medicine that work, but it's also about the being of the person that work. And I reinforce, 10 दिन जाके विपासना करो यार. किधर भी जगह मिला तो विपासना करो. www.dhamma.org. ऐसा समझो, ले प्रैक्टिस पॉइंट देखिएगा. कोई मरने वाला नहीं, तुम नहीं तो हजारों डॉक्टर है. और माँ कसम, चौथे दिन पे भाग के मत आओ. चौथे दिन में इतना सेंसेशन आता है, इतना लफड़ा होता है. राजेंद्र ने बताया होगा, अटक के रहो. All the vikaras which are trapped in the body will get released. So remember this phrase, which is very, very important. And as we go ahead, चाहे अटक गए. ये बड़ा इंटरेस्टिंग स्लाइड है शैलेश. अभी कैसा इंटरप्रेट करने का आप लोगों के हाथ में है. Many patients have told me, many doctors told, second car buy करने का था, मैंने ड्रॉप कर दिया. क्या जरूरत है साला, इतनी बड़ी टोयोटा इनोवा है. मेरे फॅमिली बैठते, इन-लॉज बैठते, झाले बच्चे बैठते हैं, का फुकट का दुसरा गाडी, काय करायचं आहे. नवीन हॉस्पिटलचा मी जागा घेतली होती, पण आता वेळ नाही. 2-2 हॉस्पिटल बघायला मला इच्छा पण नाही. मी दुसरं हॉस्पिटल नाही घेत, एक हॉस्पिटल मला जे काय मिळतं पुष्कळ झालं. अरे यार, the number of patients you see in a day is same, whether you see in 3 places or 1 place. I understand that super specialists need to actually spread themselves very thin. I understand that, but people दूसरा हॉस्पिटल भी नहीं, दूसरा और दूसरी को भी ड्रॉप किया. बहुत डॉक्टर्स लोगों ने, इससे उनको लगा कि स्ट्रेस बढ़ेगा, इम्यूनिटी कम हो जाएगी. स्ट्रेस कम करने का, इम्यूनिटी बढ़ाने का एक ही उपाय है, दूसरा को ड्रॉप करने का किटी से. तो यार सबकी फट गई थी. एंड सिलाने को भी हमने ही सीखा. And all of us, doctors and others, have found answers to our own fears across time. Fear is liberating, but fear can paralyze. Fear is actually liberating, because mild stress helps you to really cope and do phenomenal things. Ask your children. January, February में absorption of ज्ञान ज्यादा होता है, मार्च में एग्जाम होती है, जून में कुछ याद ही नहीं रहता, घुसता ही नहीं. Fear is liberating, but fear can also be paralyzing. And I would say here 2 things. I was asked half an hour ago in a session, if somebody has got scared of the entire virus and he slowly catastrophized that fear into a lot of listlessness, what to do? I said, there are many ways. There are many ways. आपने मेरा नमक नहीं खाया, अब गोली खा. That's one way. And the second way is go back to the fear with an NLP. If at all, NLP is simple. Go back to the fear, look at the fear in all 6 senses as of happening now, because the event has happened, but the fear is here. Look at the fear in all 6 senses. I remember the day when the 3 ambulances passed from my house and there was sound. And people told me they're all going to the Smashan Bhumi. ते Smashan Bhumila चालले. आणि अचानक माझं मनात अशी भीती आली की माझं पण नंबर लागणार का? 13 नंबर आएगा. आणि त्यानंतर मला भीती पसरली आणि मी स्तब्ध झालो. आणि त्यानंतर मला काही सुचेना. आणि तो वाढत, I became listless. I did not want to go anywhere. I wanted to stay at home. But when you go back to the source of the fear, you can repair the fear with a little help from Anaga, Shailesh, Prasad, Kumawat, Rajendra, or anybody, friendly neighborhood psychiatrist or psychologist. They can repair the fear. They can go back to the fear, help you to see the entire event, re-experience the entire event, slowly liberate the fear and slowly help you to come back to normal. Or you could use different methods. So सबकी फट गई थी, सिलाने भी हमने सीखा, और doctors like Vedhas, Shailesh, Anaga and everybody, and Prasad and Kumawat and Rajan should sit down with a lot of patients, ask them what are the coping mechanisms they used, because each family has innovated in some ways. I still remember one family said, we buy everything for 1 month. We bought everything for 1 month. Another family said that we cut down on certain things. And I asked them what? They said, हमारे एरिया में कांदा नहीं मिल रहा था. पब्लिक जाके सब जितना कांदा खरीद लिया, पर हमने क्या किया? जैन बन गया. कांदा नहीं खाऊंगा तो क्या और कुछ खा सकते? So ability to say no and ability to accept that certain food materials and certain food substances are not there for my diet is perfectly normal. That's a big learning, and that I think is so important. So every family has innovated, and there will be wisdom in every family. Collate the wisdom, Dr. Shailesh, Dr. Vedhas, Anaga, and write a book on that for your digital whatever. And that I think would be a great activity. Well, deaths led to emotional development. Very contradictory sentence now. Yes, crisis, breakdowns help emotional development. Vedas, तुम्हारा स्क्रीन ऑन किया तो मेरे को जब बंद करने का मैं बंद करेगा, मेरे को रोकने का नहीं है. And let me say about what is sympathy, empathy, apathy, antipathy, pati, and ganpati. So when I say deaths lead to emotional development, which when we heard about deaths, we also understood the futility of life. We understood all the good things that Dr. Rajendra said And probably my friend Ashish Deshpande also said across time, and when there's a crisis, the mind starts churning. And the mind starts churning, there is emotional development happening at a faster pace. I tell all psychiatrists, when they work in disasters, there is accelerated learning. But when they face disasters, there is accelerated development, emotional development. Isn't that beautiful? It happens unknowingly. Unknowingly it happens. Many people get paralyzed, but people go and leave food in their homes of the neighbors. My sister was positive twice, and I said, I will come and give you chicken, even if you're staying far away. अंदर से वो भावना जग गया, पूरे विश्व के प्रति एक सहानुभूति पैदा हुई, पूरे वायुमंडल के साथ कनेक्टेडनेस एक्सपीरियंस हुआ, एंड करुणा का भंडार धीरे धीरे बहुत लोगों में फूटा. So that's actually lead to empathy. Now I'll tell you a story with us that will make you smile. अभी सोच ले, अपना लेक्चर चालू है वीडियो, और ऐसा लेक्चर चालू है तो कुछ लोग बोलते ये शेट्टी क्या बोलते, आपने काय ऐकायचं नाही. एक ने बोला, मैं जाके बाजू का अपना स्विमिंग पूल में कूद जाता हूँ, थोड़ा मजा लूंगा. तो एक डॉक्टर जाके कूद गया. शेट्टी कौन है? कौन शेट्टी? और कूदा तो उसको पता चला कि उसको स्विमिंग नहीं आता है. दूसरा डॉक्टर बोला, शेट्टी गया तेल लगाने को, ये अपना दोस्त अपना आदमी है, वो शेट्टी आने दे जाने दे. वो जाके कूदा, उसको भी साला स्विमिंग नहीं आता. दोनों चिल्लाने लगा, बचाओ बचाओ. शैलेश एकदम ढन टन टन ढन टन टन ढन टन टन बोल के कूदा. स्विमिंग आता था, दोनों को उठा के लेके आया. और तब एक ने बोला, तुमको कौन बोला था उधर जाने को? शेट्टी का लेक्चर है, चलो. कौन सांगितलं तुझं लागलं? एंटीपथी. शैलेश एम्पथी, द सेकंड बॉय सिंपथी. और एकाला काही फरक नाही पडला, शेट्टीचं भाषण ऐकतच राहिलं. अपथी. आणि when I shared this incident in many workshops, they said तो पती पण आहे आणि गणपती. Empathy has increased without the efforts of the human race. क्या क्या नहीं किया लोगों ने, क्या क्या नहीं किया. And it's so important to remind ourselves of what good we have done, so that it becomes part of our software. It's so important to remind ourselves the beautiful things which we have done. It becomes part of a being. And it's so important to see all those things which should not have been done, so that we don't imitate it at all. मुझे याद है, when I did my psychiatry, many psychiatrists died without meeting each other, talking to each other. पर हमने तभी एक व्रत लिया, हम नफरत के वारिस नहीं बनेंगे. हमने कहा हम जिंदगी जिएंगे. So that's also led to a lot of empathy. थोड़ा फोटो दिखाने का इच्छा हुई. This also has happened across time because of COVID. And hate is not only infectious, it's also addictive. I see a lot of patients abusing doctors. मेरा वो एक्सपायर हो गया, और रोज मेरे को देता था फीडबैक, और फीडबैक बोलते सब अच्छा है, 4 लीटर ऑक्सीजन सब अच्छा है. पर अचानक उन्होंने कहा कि वो डिके हो गया. डिके होने के बाद तुम्हारे whatever he died. मुझे आज भी वो गुस्सा है कि ऐसा लगता है ये दिल से निकलता नहीं यार, दिल से निकलता नहीं है, क्या करूं. There are many doctors who are very angry, general practitioners in small areas whose clinic closed down for a long time. And there were financial issues with doctors also. And when the enemy is invisible, anger is spilled all over, and anger becomes hardened into hate, and hate can travel anywhere. It can get displaced. The defense mechanism which Freud said, it can be thrown at anybody. Yesterday, somebody was saying online to me, government is useless. मैंने बोला क्या हो गया? मेरा धंधा बंद हो गया. अरे यार, कोविड के ऊपर गुस्सा निकालना, सरकार के ऊपर काय को यार. पर कोविड दिखता नहीं, उसको आकार नहीं, शेप नहीं, फेस नहीं, कुछ नहीं. तो ये we'll have to work on this. All mental health professionals and doctors, when they meet patients who use a lot of hate, remember, when people talk about hate, don't get upset, because when they talk about hate, the hate is slowly dissolving. And when you put logic in their minds, I still remember so many patients that come and told me, my brother or my sister is responsible for the death of my parents. Because वो बाहर गया था, उसने लाया कोविड, इसलिए मर गया. after a lot of time, when I tell them that COVID killed your parents, not your brother or sister, is so, so important. That is something you need to really, really do. My dear friends, giving is living. Cuddling is healing. और joy of giving जान दो, वो सब जान दो, वो सब बड़ा बड़ा लोग जिंदगी भर लूट के फिर आखिर में बोलते हैं अपन joy of giving करता है, कोई फायदा नहीं. वॉरेन बफे, ओपेक कंपनी के बारे में किसी को नहीं बता, हमको सिखाने को है joy of giving. इंडिया को, Indians have been giving right from centuries. थोड़ा थोड़ा पैसा गांव के मंदिर को कुछ ना कुछ Indians देते ही हैं. It's never that they have not given. We don't want to learn this joy of giving from anybody else. And giving is living. Cuddling is also healing. And कुरवाळने मराठीत बोलतोय, कळलं कोणाला कुरवाळायचा माहितीये ना, हा दुसऱ्याला ड्रॉप करून पहिल्याला कुरवाळायचा. इम्युनिटी वाढणार and coping becomes much easier. My dear friends, volcano of grief to abode of peace. बहुत सारे लोग महाराष्ट्र में गुजर गए, 2 लाख तक, approximately up to 2 lakhs. I conduct a support group for families who have lost their victims. It's continuously, it happens every 2 weeks. If somebody wants to join, they can ask me to join. If any mental professional want to join, they can also join. And it's very fulfilling. I'll tell you why. Sachi bolu, Vedant Prasad, आशीष, राजेंद्र कुमावत, अपना बुक का जो ग्रीफ का जो है ना, वो स्टेजेस वैसा कुछ होता नहीं उसमें. पार्टिसिपेंट बोलता है 5 ग्रेन्स इकट्ठा किया, मैंने कीड़ों को खाना खिलाया, मुझे अच्छा लगा. एनिवर्सरी, मंथली एनिवर्सरी जहां मैं हस्बैंड एक्सपायर हुआ, मैंने जाके लंगर दिया अपने गुरुद्वारे, मुझे अच्छा लगा. और एक पंजाबी मुझको बोलते हैं अमेरिका में काउ कडलिंग होते हैं ना डॉक्टर शेट्टी, मैंने बोला गो सेवा रे. काउ कडलिंग को आम्ही हिंदुस्तान मध्ये गो सेवा म्हणतो. तो जाके काउ कडलिंग के. So there are different ways people cope. They may not follow the steps of grief as written in Western textbooks. And a lot of grief is resolved not by us, but by their own coping mechanism. Now, next meeting, we have 3 Ajis. One Aji does not send his son, who's a professor, to his college. जायचं नाही, तू आता एकुलता आहे. बाबा वाला तूच आहे, मला मी तुला जायला सोडणार नाही. When I told the son, I said, grief increases the pain and does not allow you to move because she's not moving. And there are 2 more Ajis in the group, but they are not joining the group. The children are coming. Next meeting will be with 3 Ajis being explained by 3 young women how to handle the grief. And it's so important for us to focus. All general practitioners, all consultants, surgeons, physicians, कोई भी है, पूछो तुम्हारे घर में किसका मृत्यु हुआ क्या. और उनको कहो रोने का में कोई शर्म नहीं है, कुछ नहीं. And you initiate small steps of grief where they can actually put the feelings on the table so that the story gets quarantined. And that is so important. As I slowly finish, देखो बॉस, मैं डॉक्टर को सबको बोलता है, तुमने दूसरा डॉक्टर को हलो नहीं किया ना, तो भी सिक्योरिटी गार्ड को हलो करने का, नर्स को हलो करने का, फ्रंट ऑफिस वाले को हलो करने का, बाजी वाले को हलो करने का, हवलदार है ऑन द वे और तुमको कुछ सिग्नल पे मिला तो कांच नीचे करके कसं झालो अरे बिडू बीट कसं झालं तुझं. आणि 1-10 सेकंड की बातचीत जो है, कनेक्टेडनेस. And I always said this all my life, when the doctor smiles at the patient gets healed. But when the patient smiles back, doctor gets healed. And this has to be accentuated and absolutely accelerated. My dear friends, the last slide. गवर्नर ने तुमको अवार्ड के लिए बुलाया या नहीं बुलाया, कोई फर्क नहीं पड़ता है. मेरे को बुलाया, मैंने बोला मैं नहीं आता, मेरा लेक्चर है. अगले दिन और किसी को दिया, मैंने बोला स्वाहा, कोई फर्क नहीं पड़ता है. पद्मश्री के लिए अप्लाई किया, नहीं मिला, तभी कोई चिंता मत करो भाई, काफी डॉक्टर्स ने अपना नाम पद्मश्री के लिए दिया है. अरे यार, पद्मश्री गया तेल लगाने को, श्री भी गया तेल लगाने को, पद्मा भी गया तेल लगाने को. निष्काम कर्म करते रहो यार. ये अपना मिस्टर कृष्ण वासुदेव यादव ने बोला था, अच्छा आदमी था. और उसके साथ तो अपना अर्जुन भाई को बोला उसने, करते रहो निष्काम कर्म, मेंटल भी अच्छा होगा, इम्यूनिटी भी अच्छा होगा, कोपिंग फर्स्ट क्लास. 4था वेव आने वाला है, कुछ मालूम नहीं, पर माँ कसम बोलता हूँ, सांस लेते रहो जैसे राजेंद्र ने बोला है, प्यार करते रहो जैसे हरीश शेट्टी ने बोला, और काम में सुख देखो, निष्काम कर्म करते जाओ. With this, I thank Shailesh, Anaga, Prasad, Kumawat, Rajendra, Ashish, and the Vedhas Nimkar, and the entire team for inviting me and being so tolerant that you waited for me. I had two other lectures, and I'm sincerely grateful to all of you. Love you all. Thank you.
Thank you so much, Dr. Harish Shetty, sir. That was truly energizing, charging, and very innovative. There is one comment, live comment from someone. It says, worthy of standing ovation. I think that sums it up all, and that tells us the mood of our audience. Thank you so much, sir. Like sir has rightly said, we, as the virus has mutated, we have to mutate ourselves. We have to build upon smaller things in life. We have to take small joys, empathy, karuna, like sir said. And a very important statement sir made, that knowledge should not really lead to arrogance. So that was a message. Sir has always given very nice messages. I remember last time when we did COVID conclave, that was a mega program. And sir had said a very touching thing back then. I am sure sir remembers, I'll repeat, sir had said that there were many families who were grieving because during second wave, the deaths were at a very high peak level. Sir had said, the family that weeps together heals together. So there is no harm in expressing our emotions. We all should be more human. If that is a good side effect of this pandemic, then it's worth it. Thank you so much, sir. I would request Piyush to bring up the virtual memento for sir, and I would request Dr. Vaze ma'am to kindly present it as a token of appreciation on the behalf of organizers and DigiShield.
And thank you for all the psychiatrists who have joined. I can see Sanganak Mishram from Dubai and so many others. Thank you for really joining this beautiful program which Vedhas and Shailesh and others have really created. Thank you.
Please accept this.
I would like to request Dr. Harish Shetty, sir, to please wait for some more time. We have lots of questions for you from the audience. And before we move on to next segment, please, Piyush, present the memento for Dr. Vaze ma'am and Dr. Busare, sir. And I request Dr. Shailesh Umate, sir, to please present it to them.
Thank you, Anaga, and thank you, Amol, for being here. Please accept this memento from us. It's virtual.
Thank you, Amol, for being there. I forgot that you were there. Thank you, Amol.
Thank you, sir. It was very nice session, sir, as usual.
Thank you, Shailesh. My pleasure entirely.
We have next very interesting segment. We have heard these three most eminent speakers. We are joined by three more equally eminent people now. We have question answer session. We have first, other than the three speakers, we have Dr. Sanjay Kumawat, sir. He is a very senior psychiatrist with more than 35 years of clinical experience. After passing from GS Medical, he has been a consultant psychiatrist in Thane and Mumbai with Fortis Hospital in Mulund, Jupiter Hospital. He is the ex-president of Bombay Psychiatric Society in the year 2007 and 8. Sir has conducted number of workshops in urban as well as rural areas and mental health camps. He has participated in many talk shows and written multiple articles. The next panelist is Dr. Shubha Thatte madam. Again, she needs no introduction really, and I feel humbled to introduce her. Madam is the senior most clinical psychologist. She holds a PhD in clinical psychology from University of Mumbai. She has a behavioral therapy course from NIMHANS in Bangalore. She has done rational emotive therapy RET course from New York. She has been practicing for over past 50 years as clinical psychologist. She's also a founder and trustee of Institute of Psychiatric Health IPH in Thane. And we have kept the best one for the last. Our third panelist is none other than Dr. Shailesh Umate, our organizing chairperson for today and my very dear friend. And he's an eminent psychiatrist practicing in Thane and Mumbai, also into sexology and de-addictions. He's the director of Insight Mind Care Center in Thane. He is attached to various tertiary care hospitals in Thane and Mulund. He is a very popular talk show participant. I'm sure all of us have seen him very regularly on various television channels, and he conducts lots of workshops for college and
Vedhas, thank you. इधर हरीश शेट्टी साहब है, कुमार सर है, बर्वे सर है, बस हो गया.
That's you being humble, but we welcome all 6 of our panelists together for the question and answer session. There have been some questions which have been put by audience. I request audience to please ask your questions with the name of the panelist into the chat box, and we will take up all the relevant ones. As we all know, this pandemic has really turned our world upside down. And right from the beginning, it's that in the present generation we have never seen something of this magnitude. I honestly remember my grandmother used to tell stories about smallpox pandemics which they used to face when she was a child. That was almost a century ago, I would say. But our generation has not seen something of this magnitude, and it has certainly changed our DNA, like Dr. Shetty sir said. From the very beginning of pandemic, the family ties have somewhat been stretched, to some extent broken. I was just coming across one article in a newspaper a few days back where one judge has said in Kalyan, I believe, that since last 1.5 years, the couples seeking divorce or coming for discordance in the family has dramatically increased manifold. So surely this pandemic has taken toll on the family ties. Perhaps the husband is in one city, wife is in another country, not being able to meet each other, a lot of quarantine rules, lockdowns, etc. The family bonding is suffering somewhere. What would be your advice? I would ask this to Dr. Shubha Thatte madam first. How would you advise this families to bond together, strengthen their bonds? What should be the strategies, ma'am? Over to you, ma'am.
Yeah. Thank you so much, Vedhas. As you rightly said, there have been the disruption is always almost like सबंध जग ढवळून निघाले.
Yes.
ढवळून निघण्यामध्ये काही चांगल्या पण गोष्टी घडतात, कारण ढवळतात तेव्हा अमृत पण निघतं. आपल्याला बघायचं की जे हरीशने जसं सांगितलं तशा चांगल्या आणि वाईट सगळ्या गोष्टी घडल्या. तू म्हणालास तसं पेपरात आपण बातम्या वाचतो की संबंध कुटुंबाने आत्महत्या केली. आपलं मन हलून जातं, आपल्याला खूप दुःख होतं. त्याच्याच बरोबर अनेक गोष्टी अशा पण आपल्याला दिसतात की वेगवेगळे लोक, हरीश म्हणाला त्याप्रमाणे एकमेकांना अनोळखी लोक सुद्धा मदत करायला पुढे येतात. मला एक उदाहरण सांगता येईल. माझी एक पेशंट आहे, एक माझी मैत्रीण आहे, आणि तिने मला सांगितलं की तिच्या नातवाचं लग्न होऊन 4 वर्ष झाली, आणि ते म्हणाले घरामध्ये आम्ही सगळं एकत्र राहतो, पण माझी नातसून कशी आहे आम्हाला माहितच नव्हतं, कारण ती पहाटे उठून कामावर जायची, संध्याकाळी नंतर उशिरा यायची, त्यांची कामं चालायची. त्यामुळे आम्ही घरात एकत्र राहून एकमेकांना समजत नव्हतो. पण ह्या 2 वर्षामध्ये ती घरात असल्यामुळे ती जेव्हा मला येऊन चौकशी करायची, विचारायची आमच्या खाण्यापिण्याबद्दल, प्रत्येकाबद्दल काय आवडतं काय नाही, तेव्हा माझ्या लक्षात आलं मी हिला कधीच ओळखलं नव्हतं, पण तिला मी आता ओळखायला लागले. म्हणजे अनेक नाती ही खूप सुधारली जातात आणि काही नाती ढवळली जातात. जी ढवळली जातात त्या नात्यांमध्ये कदाचित आधीपासून सुद्धा ती खूप ढिसाळ झालेली असते. जे ती काही पॅन्डेमिकमुळे होतं तसं नाही, आधीच त्या नात्यामध्ये विसंगती आलेली असते. फक्त पॅन्डेमिकमुळे ऑल द पीपल आर थ्रोन टुगेदर unexpectedly. When 8 people in the house are thrown together who are not used to being together all the time, त्या अशा प्रसंगामध्ये खाली आणि वर ह्या दोन्ही गोष्टी होणारच. पण मला वाटतं हरीशनी सांगितलेला जो मुद्दा इक्वलायझरचा आहे, तो इक्वलायझरचा मुद्दा इथे खूप मोठा आहे. की घरातली पण हायरार्की बदलते, बाहेरची तर बदलतेच, पण घरातली हायरार्की बदलते कशी की आजोबा असतात ते सुद्धा मदत करायला पुढे येतात. आधी त्यांना वाटतं की माझी कुटुंबातली अशी पोझिशन आहे, मी कशाला करायचं, पण आता ते येऊन सुनेला भांडी विसरायला मदत करतात. म्हणजे आपल्या लक्षात येतं की वाईट अनेक गोष्टी वाईट घडल्याबद्दल प्रश्नच नाही, आणि आपण वाईटातून चांगलं कसं शोधतो हा आपला मूळ धर्म आहे माणसाचा. आणि त्यामुळे आपण जे म्हणतो की या गोष्टी घडल्या बाहेर त्याचा परिणाम झाला, पण त्या हा परिणाम झाला की ज्या माणसाच्या आतली जी मूळ भावना आहे इतरांना मदत करायची ती दबली होती. ती कोविड सारख्या संकटामध्ये प्रत्येकाला आठवण लागली, चिंतीवर आली. याचाच अर्थ काय की कोविडनी फक्त वाईटच गोष्टी झाल्या त्याच्यामुळे असं नाही, आणि त्याच्या वाईट झाल्या त्या झाल्याच आहेत, त्याच्याबद्दल प्रश्नच नाही. पण काय काय चांगलं निघालं हे जर पण शोधायला गेलो तर अनेक आपल्याला चांगल्या पण गोष्टी दिसतात. जसं आपण आता म्हणतो की समजा 3 जनरेशन एकत्र राहत आहेत आणि इतके दिवस ते त्याच 2 BHK मध्ये राहत आहेत. पण आता एकदम काय झालं, एरवी काय व्हायचं की सून मुलगा त्यांच्या जायचे, मग नातवंडांना शाळेत पोहोचवायला आजोबा जायचे यायचे, आणि त्याच्यानंतर तरी घरातल्या दोघांना आपल्यासाठी वेळ होता. बरोबर, आता तसं झालंच नाही. सगळे एकत्र घरात एकदम असल्यामुळे त्या प्रत्येकाच्या पर्सनॅलिटीज वेगळ्या, प्रत्येकाचे स्वभाव धर्म वेगळे, त्याच्यामध्ये काही ठिकाणी क्लॅशेस झाले, काही ठिकाणी एकमेकांना खूप चांगलं समजावून पण घेतलं गेलं. त्यामुळे आपण त्याच्यात वाईट काय घडलं त्याच्यापेक्षा काय चांगलं घडलं ह्याच्यावर जो फोकस करायचा प्रयत्न केला, कारण आता आपल्याला डोळ्यासमोर दिसतंय की हळूहळू हे संकट आपल्यावरनं जाणार आहे, कमी कमी होते. ते कमी कमी झाल्यावर आपण आता सिंहावलोकनाप्रमाणे मागे वळून बघू शकतो की पहिल्या पॅन्डेमिक मध्ये काय झालं, दुसऱ्या वेव्ह मध्ये काय फरक झाला. आता जेव्हा वेव्ह कमी होते तेव्हा आपल्याला उलट चांगल्या गोष्टी शोधण्याला खूप स्कोप आहे, आणि तो आपण मला वाटतं चांगल्या रीतीने वापरला पाहिजे.
खरंय मॅडम, तुम्ही जो एक सुंदर संदेश दिलाय की वाईटातून चांगल्याची जी काही थोडीशी झालर आहे, किंवा जसं आपण म्हणतो की डार्क क्लाउड्स ना जी काही एक सिल्वर लाइनिंग आहे, एक सोनेरी संदेरी किनार आहे ढगाला, ती आपण जरूर बघितली पाहिजे. आणि आज आपण नक्कीच 1.5-2 वर्षापूर्वी जी काही आपली स्थिती होती त्यावेळेला ना औषधं जास्ती होती, ना या आजाराविषयी पुरेशी माहिती होती. मी असं म्हणत नाही की आजही या आजाराबद्दल सगळं माहिती आहे. या आजाराबद्दल खरं सांगायचं तर कुणालाच अजूनही सगळं माहिती नाहीये जगामध्ये. परंतु आज आपण नक्कीच सुस्थितीत आहोत. मागच्या 2 लाटांपेक्षा नक्कीच सुस्थितीत आहोत. सुदैवाने आत्ताचा व्हायरसही थोडासा कमी स्ट्रॉंग वाटतो आहे. तर जरूर आपण सिंहावलोकन करून एक चांगल्या गोष्टी आणि पॉझिटिव्ह गोष्टींबद्दल जास्त विचार केला पाहिजे दॅन द गोइंग इन टू द निगेटिव्ह थॉट प्रोसेस. दॅट वॉज अ ब्युटिफुल मेसेज मॅडम. ह्याच्यावरनच एक पुढचा प्रश्न आहे एका ऑडियन्सचा. डॉक्टर कुमावत सर आणि डॉक्टर हरीश शेट्टी सर दोघांसाठी. विल स्टार्ट ऑफ विथ डॉक्टर कुमावत सर. सर, व्हॉट आर द प्रॅक्टिकल टिप्स फॉर कीपिंग अ पॉझिटिव्ह माइंड फ्रेम फॉर अ डॉक्टर? ओव्हर टू यू डॉक्टर कुमावत सर.
या जसं डॉक्टर हरीशने सांगितलं की आपल्यावरती कामाचा भरपूर ओझा होता, आणि आपण ह्या गोष्टीत भूषण मानायचो की आपण कसे सकाळपासून संध्याकाळपर्यंत क्लिनिकमध्ये बिझी असतो किंवा ठिकठिकाणी जातो हॉस्पिटलला. त्या पॅन्डेमिकने आपल्या हातात स्विच दिला आणि आपल्याला एक संधी दिली की कुठं स्विच ऑफ करायचं. काही लोकांना कंपल्सरी स्विच ऑफ करावं लागलं आणि घरी थांबावं लागलं, आणि त्यामुळे काय झालं की स्वतःसाठी वेळ देता आला, परिवारासाठी वेळ देता आला, आपल्या स्वतःमध्ये एक आपल्याला स्वतःला आतून डोकावून पाहता आलं. ही सर्वात मोठी संधी मिळाली, आणि आपल्याला अजून बऱ्याच गोष्टी करायच्या आहेत. जीवन असं अनिश्चित आहे, आणि आता असा अनिश्चित काळ असताना आपल्याला जेवढा काही आनंद स्वतःसाठी आपल्या इतरांसाठी द्यायचा आहे, हा इतर केवळ कुटुंब नव्हे तर समाज पण त्याच्यामध्ये आला. त्यामुळे बऱ्याच डॉक्टरांनी समाजसेवा केली. डॉक्टर शेट्टीने जसं सांगितलं की बऱ्याच जणांनी वेबिनारच्या माध्यमातून आरोग्य शिक्षण केलं, काहींनी आरोग्य शिक्षणाच्या व्यतिरिक्त समाज शिक्षण पण केलं. आणि हा जो महत्वाचा भाग होता चॅरिटी करण्याचा, दॅट वॉज मोस्ट इम्पॉर्टंट पार्ट ऑफ फॉर डॉक्टर्स टू बी ॲट. आणि ह्याच्यामध्ये त्यांना आनंद मिळाला. काहींनी काही नवीन छंद जोपासायला सुरुवात केली, घरी राहून त्यांना काही काही नवीन छंद शिकायला सुरुवात केली. दॅट वॉज अनदर डी बस्टिंग थिंग फॉर देम ऑल्सो. सो हा जो भाग आहे की आपलं जीवन अशा प्रकारे, मी काही डॉक्टर्स पाहिले इन्क्लुडिंग मी की आम्ही घरगुती कामं पण केली, आणि घरगुती कामं म्हणजे अक्षरशः झाडू पोछापासून सगळं केलं. आणि याच्यामध्ये आपल्याला एक लक्षात आलं की आपण पूर्ण जमिनीवर आलो, आणि हे जमिनीवर आल्यानंतर जी आनंद आपल्याला एक मिळतो, जो काही आपण साधे राहण्या, आणि जे काही मगाशी डॉक्टर शेट्टी बोलले 2-2 गाड्या कशाला हव्या, आपण एक साधी विचारसरणी आपल्यात जेव्हा अंगीकारली तेव्हा आपल्याला लक्षात आलं की जीवनामध्ये सर्वात साधी गोष्ट ही आहे की स्वतःसाठी जगा, समाजासाठी आणि कुटुंबियांसाठी जगा. या व्यतिरिक्त जेवढं पाहिजे तेवढंच घ्या. त्याच्या व्यतिरिक्त घेऊन तुम्हाला पुढे जाण्यात काही मजा नाही. ती जी रॅट रेस आपण म्हणतो, त्या रॅट रेस मध्ये कुठे थांबायचं हे शिकणं महत्वाचं होतं. कोविडनी ते अर्जंट ब्रेक्स दाबल्याने आपल्याला शिकायची एक संधी दिली, एक आत्मभान मिळवून दिलं. हरीश प्लीज.
खरे सर तुम्ही म्हणालात ते, कारण की शेवटी असं आहे, आपण जसं म्हणतो की हम क्या लेके आए थे क्या लेके जाएंगे, आखिर में तो खाली सिर्फ 2 गज जमीन लगती है. तर आपल्याला कुठेतरी आपण जी ही रॅट रेस केली आहे की उगाच हे हवंय ते हवंय किंवा हावरटपणा केलाय किंवा कुठेतरी जसं हरीश शेट्टी सर म्हणाले तसं की आपण आपलंच प्रॅक्टिस वाढवायची आहे, दुसऱ्या हॉस्पिटलात जायचंय, दुसरा डालना आहे, तिसरा डालना आहे, त्या चक्करमध्ये कुठेतरी आपण जीवन जगणं किंवा स्वतःला आपले जे काही आवडी आहेत, छंद आहेत ते जोपासणं हेच आपण विसरून गेलो जणू. आणि हेही तितकंच खरं आहे की आपण आपली कामं स्वतःची करतो, त्याच्यात लाज वाटण्यासारखं नक्कीच काही नाहीये. आत्ताच एक डॉक्टर भालेंचा प्रश्न आहे, हरीश शेट्टी सर, की सुरुवातीला विशेषतः कोविडच्या पहिल्या वेव्ह मध्ये कितीतरी पेशंट पॉझिटिव्ह होत होते आणि त्यांचे फॅमिलीज त्यांना परत भिवून घ्यायला तयार नव्हत्या घरात. आपण हे भरपूर बातम्या सगळ्यांनी वाचल्यात की फॅमिलीज वर अनविलिंग टू ऍक्सेप्ट स्पेशली ओल्डर मेंबर्स बॅक इन टू फॅमिली आउट ऑफ फिअर फॉर इन्फेक्टिंग अदर्स. सर काय करावं ह्याच्याबद्दल? डॉक्टर हरीश शेट्टी सर.
Thank you, Vedhas. Just to add to my dear friend Sanjay's answer, सकाळी योग किंवा विपासना केलीच पाहिजे. मेडिटेशन करा, जे काय तुम्हाला जमलं ते करा सकाळी डॉक्टर, आणि व्यायाम पण केलं पाहिजे. मी सकाळी अर्धा तास योग किंवा आनापाना करतो आणि व्यायाम करतो 1 तास. दॅट इज मॅन्डेटरी. मी नाही सांगत ना भाई, अमेरिकानी त्यांचं सैन्याला सांगितलं योग केलं पाहिजे आणि ते करतात. आणि मी नाही सांगितलं संजय, हार्वर्डनी सांगितलं योग इज गुड. सो यू हॅव टू बी माइंडफुल अँड यू हॅव टू चार्ज युअर हायपोथॅलॅमो पिट्युटरी आयडल ऍक्सेस सो दॅट देयर इज नो स्टेरॉइड रेन and there is no increase in appetite and stress. That is number one. And apart from that, what is also very important, micro pranayam, as Sanjay always likes this term, micro pranayam in the office or whatever. And wealth is important. Nothing wrong in wealth, but what is wrong is what do you do for yourself? And that I think Sanjay said beautifully. आम्ही सगळ्या डॉक्टरांना आम्ही एकच म्हणतो, हप्त्यातून एकदा तुम्ही तुमचा झूम कॉल करा फॉर ऑल युअर पेशंट्स आणि त्यांना प्रवचन द्या. डॉक्टर प्रवचनकार पण आहेत, आपण इंडियन्स आहोत. We do not have conversation, we have pravachan. So every doctor should for all the patients once a week have 1 hour of conversation by which they can resolve all these thoughts. In a group meeting, what happens, others also come with some ideas, and that will help them do a lot of good to their patients. And also you get very little time in the clinic to address other issues. So once a week free Zoom call, no paisa, and asa kara milk tasat sagla just. Third, those who are not allowing, jisko jo jana te anat nahi ana se kai trasdak asel, silent depression बघा भाई. आपण सगळं सायकोलॉजी नका बघू. फ्रॅक्चर पण झाला असेल मेंदूचा, मनाचा, आणि मनाचा फ्रॅक्चर आहे की नाही चेक करा. PHQ-9 किंवा आस्क लीडिंग क्वेश्चन्स ऑफ PHQ-2, 2 प्रश्न विचारायचा किंवा ते 9 प्रश्न विचारायचा. तो PHQ-9 should be in your clinic. Let people rate, and then I would say, I worked in disasters in the past. In these disasters, a lot of patients have psychiatric illness also, and not only psychological illness. That has to be discovered.
There is a question from Dr. Kulkarni. Dr. Ashish Deshpande sir, तुमच्याकडून मार्गदर्शन मिळेल. He has shared a story of a young girl who got stuck due to lockdowns and all the related regulations into a foreign country for more than 3 months and resorted to alcoholism to get over that. She was all alone in a foreign country without support, friends or family. Since then has returned drinking almost 7 to 8 times a day and for almost the whole of week. So much so that passes stools and urine in the bed and in a very bad shape, apathetic. Now he's back with family but still not able to get over it. So yes, we have seen patients like that. So sir, how do we address this? Dr. Ashish Deshpande sir.
बघा, आता सगळेजण म्हणतायत तसं की लाईफस्टाईल अल्टरेशन्स हॅव अ लॉट ऑफ इम्पॅक्ट. नाव इट इज नोन that whether it is exercise, whether it is socialization, whether it is hobbies, passions, new learning, all these things have repercussions on neuronal circuits in the brain. And it is known that it is not only that exercise works because you get good physical health. The mental health, the mental neuronal circuitry also changes with all these things. Now, this particular individual probably was under lockdown in whichever part he was, and he was totally isolated. His lifestyle changed, and the behavioral activation that was absent was reducing the satiety chemicals in the brain. And when the satiety chemicals started going down, he resorted to a solution which was not necessarily healthy. The social influences led to the biological changes because unfortunately this individual was probably vulnerable to the super stimulant effect of the psychoactive substance that he was using. And then the repetitive exposures followed, and gradually in my presentation, as I had said, that glutamatergic heavy system झाली, and now the dopaminergic demands are increasing. And with the dopaminergic increasing demands, now the controls have gone out of this person's hand, and now it is repetitive. It is like a hijacked aeroplane. And this is the situation. The solution remains the same. Somewhere the person has to have some time away from the psychoactive substance. He has to be talked about what are the reasons that are perpetuating his consumption apart from the biological reasons of craving and the reward that he gets after drinking alcohol. So there has to be a detailed analysis of the adaptive disruption that has happened and the reactive dominance that is happening in him, which is leading to impulse control issues and emotional issues, and why he's not able to maintain a relapse, is able to push the relapse ahead or maintain his sobriety. So a detailed analysis will be required, and the support systems have to be created around that person so that he or she will be able to stay stopped rather than just stopping the psychoactive experience.
Yeah, Dr. Kulkarni, I hope that answers. We require detailed psychoanalysis followed by the therapy. Thank you, Dr. Deshpande sir, for sharing that. I would like to share a case of mine just yesterday. I had yesterday's last patient, as a matter of fact, in the OPD. A lady who's having cough, fever, body ache, headache, basically all classical symptoms of Omicron since past 8 days. She had already seen 2 general practitioners and they had prescribed some medications, antibiotics, etc. Her first sentence was, "Doctor, ते कोविडची टेस्ट तेवढी करायला सांगू नका, मला भयंकर भीती वाटते, ती काय मी करणार नाही, बाकी तुम्हाला जे काय करायचं ते करा." I just smiled at her. All it took was around 10 to 15 minutes of me patiently listening to her first. I'm not a psychiatrist, I'm a physician. So, but like Dr. Harish Shetty sir said, we must have some empathy. We must not forget the beautiful art of history taking that has been taught to us. Let's not make it a lost art. So that is a must for all the doctors. We must take the history properly. I just coolly asked her, very patiently and very politely asked her, पण का तुम्हाला कोविडची टेस्ट करायची भीती का वाटते? म्हणजे काय होईल? समजा पॉझिटिव्ह आली किंवा निगेटिव्ह आली, हाऊ डज दॅट मॅटर? काय फरक पडेल? And then she was just in denial. She was, नाही मला करायचंच नाहीये, पण मला होऊ शकत नाही, झालं तर काय हे ते. Then slowly she came out. मला ते उचलून घेऊन जातील कुठेतरी. मी म्हटलं ते म्हणजे कोण घेऊन जातील? तुम्ही माइल्ड केस आहात, कोणी तुम्हाला घेऊन नाही जाणार कुठे. Think about your family. If at all you are positive, we can treat you in time, or we can be cautious. You have already had 8 days. So that is something. And then there is another patient of mine who's a young boy who's last 2 years I must have I have lost the count honestly, but he must have taken more than 50 or 60 COVID PCRs. Due to his work, he's constantly exposed to the sawdust, and he has chronic bronchitis and frequently has cough and exacerbations. He is also scared. So that brings this whole idea of COVID anxiety. We have seen that many of the patients, either this way or that, have been very anxious about COVID. I would like to ask Dr. Barve sir and also Dr. Kumawat sir. Sir, ही anxiety जी आहे patient मधली COVID anxiety ही कशी address करता येईल sir? We'll start with Dr. Barve sir.
Yes, please.
सर अनम्यूट करा. बर्वे सर अनम्यूट करा.
Barve sir, तुमचा speaker unmute करा please.
Okay. Okay. The anxiety and the fear, and I always said that the worst kind of pandemic that gripped the world is not just corona, but the fear of corona.
Absolutely.
So if one person is affected, the whole family is affected by the fear of corona. Essentially because the kind of news that came out, the kind of chaos that was projected through media, people waiting for that medicines to be given, and injection nahi milat, he nahi milat, so many things. So it did create fear, but these are triggers, and we are reacting to those triggers, or we are overreacting to these triggers, and actually that is what brings down the immunity. So I think a detailed talk with these people, talking to them, and then getting to the real fear, like you said, the fear of this, the fear that the woman had was that she's being picked up and put in a van and she's being away from the family. Her fear is not corona. Her fear is being estranged from the family, and she has this recurrent image of being picked up and put in an ambulance. This is what I would say, this is what mindfulness is all about. This is what is carrying her all the time, and this is that internal trigger which creates the anxiety, and she has to learn to let the anxiety pass, because this image is what is constantly with her, and that image is disturbing her. It's not just COVID, it's just not corona, it's just not that test. The image which sticks to her, and if you go back, she may have similar experiences in the past. She has suffered from such kind of anxiety. It's likely that she has a proclivity to have this kind of these images and this fear. So I think very important, sitting and getting to the root of the problem. From where does this exactly, what is exactly your fear is. Second thing I think we have not discussed, and I have said this to so many people, that I've asked them to do two things every day. Number one, write down in black and white. Don't use mobile, don't use computer, don't use a keyboard. Pick up a paper and pen and write down exactly what are you afraid of. Exactly, in clear words, write down, this is what is really I am afraid of. I tell them 50% of the anxiety will pass just because you put it out of the system. You can put it on paper and you look at it and say, ye to kya hai, yada hai kami, why am I afraid? So I'll put it away. Very important. So you become monitor, you start become sakshi of looking at yourself. Second thing I've told them is that write down what good feelings you had today. What are the good feelings? What are the right things that happened to you today? Somebody called you and I felt good. Somebody said something to me, like Harish said. Somebody said, hi, kaise aap to me? It makes me feel good. Write it down. So and so said good to me and I felt good. Third thing which I say in this writing diary is that check yourself. What are you grateful about? Gratefulness is a very, very powerful tool in terms of positive thoughts and positive emotions. That gratefulness is what? Gratefulness, not Hindi picture type that somebody comes to senior and touch the feet. That's such a mechanical ritual that everyone does. It has lost its meaning, it's lost its purpose. Gratefulness is here. And what is ultimately gratefulness? You are grateful for what? What you have. You can't be grateful for something you don't have. When you write down, I'm grateful today for something. And that grateful feeling shouldn't be that, oh, my parents gave me birth, so I'm grateful to them. हाँ ठीक है, ये तो रोज बोलता है. I don't know whether you mean it or not. But I saw a beautiful sunrise today. I'm grateful that I saw that bright light. I saw a cat looking after her kittens. Wow, I'm grateful for that. I saw a flower blooming. I'm grateful for it. This is what is happening around you, and as if you are grateful because they give you that energy. So and this is just not I'm saying, this is not just a good feel. It's not a poppycock. It's not DIY yourself. A tremendous amount of research has been going on in people writing gratefulness diary. Peter Seligman has talked a lot about this. Tal Ben-Shahar has talked a lot about how positivity can be maintained by writing gratefulness. So people who are anxious, give them. I don't know. There is nothing I feel grateful about. Then I said, okay, you are talking to me. I'm talking to you. Be grateful to me today. यहाँ से तो शुरुआत करो. I'm going to be grateful today because you asked me a question and I took some time and I'm sure that you were there to ask me questions. I'm grateful to you because you are a patient. That defines my role. I'm grateful to you because you are a client. I exist. So make a beginning in a very small way, in a very, very small way, and start writing that diary. And within 6 weeks, you'll find that your gratefulness diary is swelling and you'll keep on telling people that I am grateful to so much. So these are the ways that people can shift from feeling bad, feeling miserable, to try to find out what is good about me, what is it that good lies within me, and I'm trying to search for it. Unless you search, you don't get it.
Thank you, Dr. Barve sir, for sharing that thought. I think that should be the great first step, writing a gratefulness diary. That should be the great first step in the right direction. Dr. Kumawat sir, would you like to add something?
Dr. Subha Thatte ma'am wants to say something like this.
Yeah.
Dr.
Kumawat sir first.
संजय first.
होतंय काय की सतत मीडियाकडनं आपल्याला जी इन्फॉर्मेशन सतत येत असते, सोशल मीडियातनं जे काही मेसेजेस येत असतात याचा अतिरेक होतो आणि एक आपली त्या आजाराबद्दल नकारात्मक भावना निर्माण होते. आपण 3 वेव्स पाहिल्या, त्या 3 वेव्स मध्ये साधारण एक सरासरी 3-4 महिन्याचा एक चांगला काळ गेला. पहिल्या वेव्ह मध्ये हाहाकार उडाला, उपचारांची काहीही माहिती नव्हती आणि आपल्या कानात सतत अँब्युलन्सचे आवाज येत होते आणि आपण फक्त त्या पेशंटचा जातानाचा जर्नी बघत होतो, रिटर्न जर्नी फार कमी बघायला मिळत होता. दुसरी वेव्ह आली, दुसऱ्या वेव्ह मध्ये तर बेड्स नव्हत्या, ऑक्सिजन नव्हते, औषधं होती, त्यांची प्रचंड किंमत होती, काळा बाजार चालू होता. ह्या 2 वेव्ह सततच लोकांच्या समोर गव्हर्नमेंटनी पण आणि मीडियानी पण सतत ठेवल्या आणि त्यात तिसरी वेव्ह जेव्हा आली तेव्हा वास्तवात तशी परिस्थिती नव्हती. आजाराचं स्वरूप तेवढं तीव्र नव्हतं, आजारात ऍडमिशन्स तेवढ्या होत नव्हत्या, आजाराची मुदत एक 4-5 दिवसाच्या पलीकडे नव्हती आणि हे वास्तव सतत ठेवणं हे मीडियाचं काम होतं. परंतु दररोजच्या किती हजार पॉझिटिव्ह आले, किती हजार ऍडमिट झाले, किती मृत्यू झाले, या गोष्टींना अतिरेकी महत्व गेलं आणि या नकारात्मक बातम्या जेव्हा तुम्ही सतत तुमच्या कानांनी किंवा डोळ्यांनी ऐकत पाहत असता तेव्हा तुम्हाला तो त्रास वाढत जातो. आता हे टाळण्यासाठी आपण जे काही सकारात्मक गोष्टी आहेत या संपूर्ण ह्याच्यातनं घडलेल्या किंवा ज्या काही आपल्याला सतत पॉझिटिव्ह सतत चर्चा करणारी जी मंडळी आहेत यांच्याशी संपर्क ठेवणं अत्यंत आवश्यक आहे. की आपल्या घरात असतात, आपल्या नात्यांमध्ये असतात, आपल्या आजूबाजूला असतात. त्यानंतर आपण प्रिव्हेंटिव्ह म्हणून ज्या काही गोष्टी करायच्या असतात ते करणं आपल्या हातात असतं. या उपर जरी आपल्याला आजार झाला तर त्याला मी काही करू शकत नाही, तेव्हा प्रिव्हेंटिव्ह गोष्ट सतत करणं अत्यंत महत्वाचं आहे आणि आजार आणि त्याचं वास्तव याची नेहमी सांगड घालूनच विचार करणं अपेक्षित असतं. आजाराचा जेव्हा अशा नकारात्मक गोष्टींमुळे आपण अतिरेकी भीती मनात निर्माण करतो त्याचं कारणच आपण हा काल्पनिक एक भीती निर्माण झालेली असते. त्याच्यापेक्षा वास्तवाची जर त्याची सांगड घातली की आजाराचं स्वरूप काय, किती जणांना झालं होतं, किती जण ठीक होत आहे, ही जी वास्तवापासून आपली नाळ तुटली की मात्र अशा प्रकारची भीती वाढत राहते आणि आपण त्या गोष्टी टाळत होतो. त्या महिलेने ती गोष्ट स्वीकारायचं तयारी ठेवली नाही की मला ती टेस्ट नको. टेस्ट करणं म्हणजे पण तिला असं वाटलं की सुरुवातीच्या काळात ज्या प्रकारे आयसोलेशन कंपल्सरी करण्यात आलं, सोसायटीला किंवा घरांना सील लावण्यात आलं, तशी भीती आज राहिलेली नाहीये. आज कोणी इतक्या लगेच सील वगैरे कोणी करत नाही किंवा असं उचलून देत नाही. हा सगळा काळ आता मागे पडत चाललाय. आता लोक होम क्वारंटाईन मध्ये राहत आहेत. होम क्वारंटाईन मध्ये पण बऱ्यापैकी त्यांची रिकव्हरी चांगली होतीये डॉक्टरांच्या मार्गदर्शनाच्या मध्ये. तर अशा प्रकारे हा जो वास्तवचा डोळ्यासमोर आहे तो सतत मीडियानी पण लोकांच्या समोर ठेवणं आवश्यक आहे. तशी बातमी आपण सतत पाहिली पाहिजे, तशा लोकांशी संपर्क ठेवला पाहिजे जेणेकरून आपल्याला एक मानसिक एक सकारात्मकता निर्माण होईल. आणि ती झाली की मग अशी भीती जी आहे, अशा प्रकारे आजाराचा स्वीकार करण्याची मानसिकता आहे ती तयार होणं आवश्यक आहे. मॅडम.
वेदस तू सांगितलंस त्याच्यावरून मला एक गोष्ट आठवली की
मॅडम.
हॅलो, ऐकू येत आहे?
येस मॅडम.
पहिल्या कोविडच्या वेव्हच्या वेळी आय गॉट अ फोन कॉल फ्रॉम अ फॅमिली आणि त्यांनी सांगितलं त्यांची आई 75 वर्षाची आहे आणि गेले 4-5 दिवस शेअर बिकम ऑलमोस्ट पॅनिक स्टेट मध्ये गेले. ती शेअर बीन अ स्ट्रेंथ ऑफ पिलर फॉर द फॅमिली ऑल द टाइम. शी वॉज व्हेरी मोबाईल डुईंग एव्हरीथिंग फ्रॉम होम. पण ही एकदम जी भीती निर्माण झाली त्याच्यामध्ये त्यांनी कोणाशी बोलायचं थांबलं, सतत रडणं. मग म्हटलं त्या माझ्याशी बोलायला तयार असतील तर आम्ही टॉक टू हर आणि ऑनलाईन सेशन मी त्यांच्याशी घेतलं. तर बोलताना असं लक्षात आलं त्यांनी जे सांगितलं की त्यांच्या मोठी जाऊ एक ती गेली, त्यांच्या नात्यातले आणि एक गृहस्थ गेले आणि तिसऱ्या जवळच्या ओळखींचे त्यांनी ऐकलं की ते आजारी येत आणि ICU मध्ये. तेव्हापासून मला ही भीती वाटायला लागली. म्हटलं का भीती तुमची, कशाबद्दल आहे? मग अशी बाकीच्यांनी सांगितलं त्याप्रमाणे जेव्हा मी डिटेल हिस्ट्री घेतली तेव्हा त्यांनी सांगितलं की मी त्या पंचखात्यात. म्हटलं म्हणजे काय? म्हणजे 2-3 माणसं गेली म्हणजे आता पंचक पूर्ण होणार, पाठोपाठ 2 माणसं पाहिजेत आता आणि त्याच्यात आता माझा नंबर आहे मला माहिती आहे. म्हणजे आपल्या लक्षात येईल की त्यांच्या डोक्यामध्ये काय काय कन्सेप्ट असू शकतात वगैरे. ते जोपर्यंत आपण काढत नाही तोपर्यंत त्यांची भीती कमी होत नाही.
खरं आहे मॅडम. That brings us to another set of patients. I would like to ask Dr. Umate sir first and then Dr. Deshpande sir also. We have seen, especially during first wave and second wave, fortunately the admissions are very less in this third wave, so-called third wave. But during first and second waves, the patients were admitted for even longer duration than now. And they're completely isolated, disconnected from their families. Naturally, being a COVID hospital, the relatives are not allowed inside. They don't even see their doctor properly. Doctor is always in a PPE kit. You know, patients typically describe to me as astronaut sarka kaitari ghalun yeta sagla. They can't see you. They can't see your face. We are all in double masks and shields and whatnot. So is the staff, and their only source of connection with the outside civilized world is perhaps a phone. And in case of older patients, they are not even able to do telecalls or video calls or something. That leads to anxiety, and it has been well documented. How do we address this? What can we do to help these patients who are in the hospitals all alone by themselves with a diagnosis of COVID and physically suffering, having breathlessness, being on oxygen? डॉक्टर उमाटे सर काय करता येईल? आणि उमाटे सर नंतर डॉक्टर देशपांडे सर तुम्ही पण काही ऍड कराल?
Absolutely. Vedhas, right now the situation is not like that, but yes, in first wave we witnessed it. Nobody was ready to check the patient. Nobody was ready to go to near the patient. It was sheer lack of knowledge and fear in everybody, how the disease is going to kind of do changes in the patient also as well as in the doctors also. So minimum communication, minimum spending time with the patient that has happened, because the slogan also was there in the first wave, keep physical distancing, keep social distancing, it was there. So we always emphasized in the first wave, it should be physical distancing, not social distancing. So you need to find out the various ways of being in touch with the patient, like either with the phone calls or keeping a distance of 6 feet, try to talk with this patient. Somehow many of these patients, in fact, we had a good discussion over this topic where psychiatrists whom themselves have suffered the of the COVID, they had all come and they said emotional touch has to be done. In fact, one of the psychiatrists very beautifully explained, she was in the hospital and said she couldn't connect with anybody. One mouse, she was there. She used to come to clean the things from her bed and she used to ask her, "Kasha hai madam tumhi ata?" Ani te tila evda healing touch hoto ki are somebody is asking to me. So this beautiful art, it is not just doctors, but some workers in the hospital, they can be of a touch with you. So she said that healed me a lot. Somebody's coming and asking me. So definitely, that was the time where everybody was unknown what to do. But now we realized, now we also see that many doctors are not in PPE kit. They're just wearing mask and going and talking. We are also talking. So probably the waves are changing and we are also changing. Yes, now what we have to look, if that has caused some trauma, like PTSD kind of thing, if that has caused, and then we have to solve that PTSD, post traumatic stress disorder, जे काही पेशंटला आता आला असेल तर ते आता आपल्याला बघायचं आहे. देशपांडे सर.
हा, म्हणजे पहिली गोष्ट म्हणजे अज्ञानात दरवेळेला सुख असतं असं नाही. अज्ञानात बरंच दुःख असतं आणि पहिल्या वेव्ह मध्ये ते तसं खूप झालं. दुसरी गोष्ट म्हणजे कुठल्याही अशा गोष्टी ज्या होतात ज्याच्यामध्ये आपल्या मनाला फार त्रास होतो, त्याच्यामध्ये आपल्या मेंदूमध्ये एक लोकस सिरुलियस नावाची जागा असते जिथे ॲड्रिनलिन नॉरएपिनेफ्रिन फार मोठ्या प्रमाणात वाढतं आणि ह्या लोकस सिरुलियसचा आपल्या मेमरीच्या मेंदूशी फार जवळचा संबंध असतो आणि तो संबंध जर डिस्कनेक्ट झाला तर जसं शैलेशने म्हणालं की PTSD पोस्ट ट्रॉमॅटिक स्ट्रेस डिसऑर्डरचा आजार जो आहे तो जाणवायला लागतो. पण आजार फक्त व्हायलाची गरज नाही, पोस्ट ट्रॉमॅटिक स्ट्रेस पण वाढू शकतो ज्याच्यामध्ये अँझायटी, डिप्रेशन, रिलेशनशिप इश्यूज हे येऊ शकतात. अगदी PTSD व्हायलाच लागतो असं नाही. आणि त्याच्यासाठी जे उपाय आहेत त्याच्यामध्ये जे पहिला उपाय आहे बिहेवियरल ॲक्टिव्हेशन प्रोग्राम, ज्याच्यामध्ये आपल्याला जे काही छंद वगैरे आत्ता आपण बरेच बोललो ते इम्प्लिमेंट करायचे. दुसरं आहे कोपिंग स्किल्स चांगल्या करायच्या, ज्याच्यामध्ये आपल्या डे टू डे ॲक्टिव्हिटीजमध्ये ज्या काही ताणतणाव येऊ शकतात, जे काही संघर्षाचे क्षण येऊ शकतात, जे काही त्रासदायक क्षण येऊ शकतात, त्याला बायपास करण्यासाठी आपल्याला काय करता येईल किंवा त्याच्याबद्दल वेगळा विचार आपण कसा करू शकू त्याचा विचार करायचा. आणि तिसरं आहे ग्रीफ अँड ट्रॉमा इंटरव्हेन्शन कॉग्निटिव्ह नॅरेशन, म्हणजे आपण आपल्याबरोबर जो संवाद साधतो, म्हणजे आपण आता बोलत होतो की पहिल्या वेव्हमध्ये एकटं राहिलं असताना त्या व्यक्तीच्या मनामध्ये स्वतःच्या आजाराबद्दल काय विचार चालले होते, हे विचार हे जे स्वतःच्या बरोबरचं संभाषण असतं ते खूप महत्त्वाचं असतं, कारण ते ठरवतं आपल्या मनामध्ये भावनांचा कल्लोळ किती होणार. आणि हे कॉग्निटिव्ह नॅरेशन जे आहे ते बदलण्याचा प्रयत्न ज्या थेरपीमध्ये केला जातो त्याला ग्रीफ अँड ट्रॉमा इंटरव्हेन्शन कॉग्निटिव्ह नॅरेशन असं म्हटलं जातं. आणि त्याच्यामध्ये वेगवेगळी टेक्निक्स असतात. लहान मुलांसाठी वेगळी टेक्निक्स असतात, मोठ्यांसाठी वेगळी टेक्निक्स असतात. त्याच्यामध्ये बेसिक असं असतं की आपण जो काही अनुभव घेतलेला आहे तो आपल्या मनात आणायचा, त्याच्याबद्दल बोलायचं, ते कोणाला तरी सांगायचं आणि ते सांगत असताना आपल्या त्याच्याबद्दलचे जे विचार असतात त्याचं संभाषण थोडंसं आपल्या मनाला चांगलं होईल असं करायचं. त्याला DDWW टेक्निक असं म्हटलं जातं आणि ते मुलांसाठी आणि मोठ्यांसाठी वापरलं जातं. ह्या 3 टेक्निक्सचा म्हणजे बिहेवियरल ॲक्टिव्हेशन, कोपिंग स्किल्स आणि कॉग्निटिव्ह नॅरेशन या 3 गोष्टींचा विचार करून आपण तो जो त्रास जो आहे तो कमी करू शकतो.
Thank you, Deshpande sir, for teaching us this quick coping techniques, and Dr. Umate sir for that wonderful line that let's have physical distance, let's not distance emotionally or socially. There is a question from Dr. Kavita Nimje. Harish Shetty sir, बहुतेक आपण जसं आता बरेच जण म्हणाले की कितीतरी सोशल मीडियामध्ये जे काही हाईप होतं किंवा उगाचच घाबरवण्याच्या बातम्या दिल्या जातात त्याच्यामुळेही एक खूप लोकांवर इफेक्ट पडतो. सोशल मीडियाचे आपले फायदे आहेत, सोशल मीडिया हॅज हेल्प्ड अस कनेक्ट इन द पॅन्डेमिक टाइम्स, पण त्याचे तोटेही तितकेच आहेत, लाईक फेक न्यूज और अनसायंटिफिक इन्फॉर्मेशन बीइंग प्रोपोगेटेड. सर तुम्ही काय मार्गदर्शन द्याल यावर हरीश शेट्टी सर? हाऊ टू हँडल द सोशल media anxiety or how to handle the adverse effects of social media and use it in a positive way?
Absolutely. I think just a line on fear. Fear मध्ये fear of death पण असतो, तो एक मोठा fear असतो and that is hidden. बघा असं आहे की when the body is malnourished, virus spreads. when the society is malnourished, rumors spread. So what is very important is to address the distress and belief in the rumors actually go down. That is one. Distress is handled. You believe largely rational news, rational thinking. When the distress is not handled, you believe anything and everything. Number two, what is the hygiene you use? काय तुम्ही hygiene काय वापरता? किती बघणार, काय बघणार आणि कुठपर्यंत? तेव्हा संपूर्ण फॅमिलीमध्ये एक रिसर्च ऑफिसर असतो, तो सगळ्यांना त्रास देतो. रिसर्च सायंटिस्ट, कोविड सायंटिस्ट, त्याला पाठोपाठ असते. वर्ल्ड हेल्थ ऑर्गनायझेशनने काय सांगितलं, ह्या लोकांनी काय सांगितलं, आणि तो रोज घरी प्रवचन देतो. आयडेंटिफाय द सायंटिस्ट अँड विथड्रॉ हिज डिग्री. आणि त्याला सांगा गप्प बसायचं, तुला सायकॅट्रिक पेशंट वाढवायची इच्छा आहे का? बिकॉज त्याला जीवनात अर्थ मिळतो. आय फाइंड अ मिनिंग बाय एज्युकेटिंग अदर्स. त्याला गप्प बसवायला. आणि sometimes in psychology, Madam Shubha will agree, and Ashish, the brain doctor, and Rajendra, the mindfulness doctor, and Shailesh, the king of all. Behind an emotion or a behavior are stories, and behind that there are many stories. So sometimes Shubha Taini sangitla ki look behind and see if there has been any other things also in the past, and others also have done. So that also helps. But घरी डिजिटल हायजीन कितपर्यंत कोण आणि काय करायचं तो सगळ्यात इम्पॉर्टंट. पण सगळ्यात मोठं म्हणजे जस्ट लाईक व्हायरस स्प्रेड्स फास्टर इन malnourished bodies, rumors spread faster in malnourished society. डिस्ट्रेसला हँडल करणं अत्यंत आवश्यक आहे. It cannot be. I have told all the housing complexes to have one meeting in 2 months for people to ventilate, and you may have a psychologist who will do some free work or psychiatrist. Very important. I told corporators, ward मध्ये तुम्ही Zoom meeting लावा आणि प्रवचन द्या. It is not essential for Uddhavji only to do the FB meeting. So community intervention also helps individual families. Individual families also intervene so that these rumors don't spread. Thank you.
Said that, sir. Rumors should not spread, and we should have little more of pravachan. I would like to request here Mr. Dipen Mehta from DIGIShield. Sir, हम भी अपने eminent panelists के साथ लेके एक general public के लिए अच्छा सा प्रवचन रखेंगे in a very good way, in a positive sense.
DIGIShield को एक minute Vedhas. DIGIShield should do it every week free of cost for the society. भाई थोड़ा तो मैंने कितना बड़ा दिया lecture.
सुन रहे हैं. I'm sure he will take note of it.
And number two also, what is extremely important also is that unless the community takes care of everything, things will not change.
Yes, sir.
Parvez wants to say something.
I want to say something. Something that we have missed is the three very interesting words I came across. One is we talk about post-traumatic stress. The popular word now is pre-traumatic stress. Before the trauma occurs, people are already suffering from stress. Like the lady that you talked about, Mala uchlun घेऊन जातील. Classical case of pre-traumatic stress. Second word which was spoken by many people was post. This is what Harish spoke in a very loud and clear, is that post-traumatic growth. This is the nangurun ठेवलेली जमीन. It's like a beautiful soil is red and we have sown the seeds of growth. So it is going to grow. Following every pandemic in the past, if you study, there's always been huge growth in science. So I think that is going to happen. We are waiting for it. One more important word which we have not spoken, which has happened in the past, and I think this is where social media can play a very important role. The pravachan also can play a very important role, is tell the story of resilience. Because we're not talking about resilient people, how people have overcome, how people have bogged down, lost spirit, traumatized, etc., blah, blah, blah. The media, the social media, and the people should come and talk about, see, I suffered, and this is how I work. My family lost someone. This is how we are working it. Absolutely. So stories of resilience are the stories which now the community is hungry to listen to these stories of resilience. Like after a war, there are many people who come and how they fought the war, how they were alone in the bunker and their friends were blown up and still they fought on. You know, that the कुसुमाग्रजांची कविता है अब्दुल हा लड़ने वाला. We want to listen to such stories of people overcoming their problems. So the media should take note, and during every time there has to be sharing that this is what went wrong with me and this is what I worked, which are my coping mechanisms.
Yes, Subhasatte madam is giving a big thumbs up for that, and that's true. Stories of resilience is, yes, that's like giving the positive vibes, and that helps a long way. That brings us to another very important question. That is for you, Dr. Thatte madam. In this pandemic, right from the beginning, we have had a lot of issues with children, especially school-going children. The classrooms are shut. The kids have been locked up at home. In the beginning, parents were scared. They were not even letting the children play outside. So the natural growth, emotional growth, psychological growth, and physical growth of a child is to an extent thwarted or stunted. Even now, there was a period of lull in between before the third wave, and the schools were just about reopening. But unfortunately, we had a third wave, and the schools had to close again. Today's Times of India gives out a survey. In Maharashtra, we are going to open the schools from next week, and today's survey says 62% of patients in Maharashtra are against sending their kids to the school. So, what can be done for the
who has
growth of
done
this
it?
school
You have to find the NGO which has done it, which I checked, and the sampling is not correct. You have to go behind the motive of that NGO. Why did they do the survey in a certain sample? But though I agree with you, Vedhas, it's a very important.
What I mean to say here is that I don't endorse that survey, but what I mean is there is this undercurrent of thought with some of the parents that parents are still worried about sending their children to the school. So basically, the big question over here is how do we address that? How do we make sure that the next generation, which is our future, is not emotionally stunted? So what can be done? That question is first to Thatte madam, then to Shetty sir also, and other panelists also. We'll start off with Thatte madam.
Yeah. So education was certainly affected a lot, and everybody knows about it. But that education has affected differently at different stages of life. Like primary children were affected in a different ways, secondary and high school or college. See, a child who was 15 years old when the pandemic started, and now he's 17 years old. 15 to 17 were very important years in his life. To be with the peers, to mix with them, to learn so many things, how to make friendship, how to nurture the friendship. He has lost the opportunity to learn any of these things. There were many teenagers who were in a relationship with somebody. And during this pandemic, because of the misunderstanding of the Facebook messages, there had been a lot of breakups because of that, leading to a lot of distress in them also. Now you will find out that children who were very, very small. I remember one of my family friends whose child was born in May 19, 2019. When the child was still 6 or 7 months old, obviously he was not taken much outside. But afterwards was the pandemic for 2 years. The child was restricted only to home. The father is working from home and mother has to go on her duty. This child has not seen a third person for almost 2 years. So after that, when he went out somewhere, he was so afraid of seeing any human being because he had never seen. They are staying on the 16th floor. The child has not seen anyone. So these kind of different trauma had been there all these 2 years. As we said about sending to school. Now, sending schools, obviously some schools have kept it optional to the parents. If the parents group, the majority of them are willing, then only the classes will start out of the way. So the parents are also so afraid. And as you, all of us rightly said, because of the media messages. So WhatsApp University is something which has done a lot of harm to society because of that. Because people read something and they believe in that. And obviously the parents are not silly to say. Children are willing to go. Children want to learn offline. They want to meet teachers face to face. There are some children who got, say, last time 10th standard exam, 95% marks. And they said, we are not happy. Otherwise, if I had had 95% marks, I would have been very happy. But I'm not happy because I know nobody has assisted us, nobody has tested us. And I'm considered to be equivalent to another child, another boy in my class who I know is Duffer. He also got 92% marks. So they can't even enjoy even if they got good marks. So there are many such cases and many such issues as far as education is concerned. I also remember some girls from very remote places who were staying in Thane in government aided hostels, and they had to go back to their villages. And that girl has to climb up a tree so she can attend the online classes.
Oh.
There is no connectivity anywhere. She has to climb up a tree and sit with her laptop. Now, children have studied in this kind of situation. And that is something which is of what we say as the resilience. That in spite of the adversities, they have come up doing their following up their studies and classes and everything. So on the contrary, we should see to it that children who are coming up later on to this stage, it's not necessary that they will be deprived of something. They may be proud of something also. In spite of these adversities, we could do and we could achieve something.
Well said, madam. Especially about what you said about the rural people who we assume that Zoom is a way of life for us, or maybe virtual conferences. But what about the rural folks where the connectivity issues are there? Like madam rightly said, Harish Shetty sir, to me.
Yeah. I have been in touch with the government and have written articles. And why should schools? There enough research across the world that when you weigh the school starting and the risk, the starting of the school is always healthy for children. I was in Afghanistan years ago when the Russian army was thrown out, and the 14 years schools were closed, and we had gone to do some work on PTSD. The teachers there could not open the schools, but they started tents and started calling children, and that really changed the health of the child. That's number one. Number two, I'm not shocked at the fear of parents to send children to school. Many of them are suffering from what you call as hyperarousal and hypervigilance because of the first and the second waves. आणि तो भीतीमुळे जे काही we have decided, they feel that they have an exaggerated fear that their kids will be very greatly affected. Third is, in many schools, they may not be able to follow a lot of protocols by the government, and also traveling is very difficult as of now. And so there are other, but most important is fear, hyperarousal, hypervigilance. मला आता भानगडीत पडायचं नाही, जाऊ दे आमचं मुलं आहेत. And the fourth thing, which is also very important, is how to start the schools. It has to be voluntary. Number two, you can't start the school straight 100%. You can't allow the tigers who are inside the tent to just rush out. So you have to start mindfully. Let them come for 1 or 2 days, for 1 or 2 hours in a week, and then do a little offline, online, then slowly progress. You can't have the same rule for every district, every village, every state, every city. As you do it, let the teachers also understand that 50% mental health work and 50% curriculum. Asa karat, if they are handheld by the department, by the Ministry of Health and Ministry of Education, and in the ward, if they identified every ward, they identify mental health professionals who can assist the schools free of cost. That would be the right way of starting. And after that, there will be number of cases in the children, no issues at all. फट करून 50 मुलाला पॉझिटिव्ह. काय स्कूल बंद नाही करायचं, त्या 50 मुलांना तुम्ही पाठवा घरी, एका हप्त्यात त्यांना पुन्हा आणा, पुन्हा 50 लावू द्या, पुन्हा आणा, काही बिघडणार नाही. पण that terror and the fear of the 50 school having COVID positive should be muted and nipped in the bud, and this is how the school should start. UNICEF is very clear, or you should read their research very clearly, very, very clear. And for the first time in 75 years or many years, UNICEF have come out with their annual report on mental health for the first time. And you should read the report. And that is very, very important, very, very, very interesting. Today, I'm going to pen an article of how to start schools. How to start schools. It cannot be just hajaro mula ekatra aale aaj. Nahi honar to. It should be start mindfully. Start low, go slow, the way we treat elders for mental illness. Start low and go slow, and go gently and slowly. That I think is important.
I fully agree with what Dr. Harish Shetty sir said. That's the absolutely balanced and correct approach towards starting the schools. Because I, as a physician, and I'm into infectious diseases, we always have this concern that in children, pediatric age group, the disease severity is very less, mortality is very less. But the real fears are about suddenly all the children going to the school, coming back home, and being super spreaders or carriers and infecting especially the elderly members of the household who are so-called protected because they don't venture out, they don't step out of the house. So that is also a concern. So what Shetty sir said addresses it to a large extent. We have to start the schools in a staggered manner, step by step, one step at a time, and not like all the caged tigers suddenly gushing and roaring into the wild. That is absolutely correct, sir. I would like to request Dr. Umate sir and then Dr. Deshpande sir and then Dr. Barve sir also to address on this, because this is something very burning issue, very relevant issue, and most of the doctors are also facing the same at their own household, because their own kids, especially those doctors who are younger generation and having school going kids. Dr. Umate sir will start off with you, then on to Dr. Deshpande, and then on to Dr. Barve sir.
Yes. As what I understand about this virus is some or other time it is definitely going to infect each and every person on the earth. आज नहीं तो कल, कल नहीं तो कल होने ही वाला है. So, but today in third wave, what we see is the lethality of this virus is less. 3, 4, 5 days of fever or infection and the person is back to this thing. So, Shetty sir said very rightly, you have to kind of start the school. If the students who are exposed, take them out, continue the school. फिर और किसी को होएगा उनको बाजू रखो. कभी ना कभी तो इन्फेक्शन होने वाला है. सो जैसे जैसे इसकी इंटेंसिटी कम हो रही है, यू नीड टू काइंड ऑफ कॅनॉट विथहोल्ड द हे आनंद आहे ना मुलांचा, जसं थत्ते मॅडमनी सांगितलं की त्यांचा एक पियर ग्रुपचा आनंद आहे, त्यांच्यापासून आपण त्यांना वंचित ठेवून चालणार नाही. नंबर 1. नंबर 2, जर वर्ल्ड मध्ये बघितलं तर ओनली इंडिया हॅज नॉट स्टार्टेड द स्कूल. Rest of the world has started. It is going on. So definitely, with some strategy, we need to kind of start the school. But at the same time, parents need to be educated and taken into confidence. It may not be mandatory. हे सगळ्यांना करायलाच पाहिजे असं नाही, but slowly it has to be done. Thank you. देशपांडे सर. Yes sir.
असं म्हटलं जातं की इन एज्युकेशन इमोशन्स कम बिफोर अकॅडमिक्स. आणि जसं हरीशने म्हटलं तसं देर हॅज टू बी अ लॉट ऑफ टाइम ॲलोकेटेड टू द इमोशनल नीड्स ऑफ चिल्ड्रन हू अटेंड स्कूल. द सेकंड थिंग इज, आत्तापर्यंत जो काही प्रयत्न झालेला आहे ऑनलाईन एज्युकेशन वॉज द वन दॅट वी यूज बिकॉज देर वॉज नो अदर अल्टरनेटिव्ह अवेलेबल. पण ऑनलाईन एज्युकेशनचे आउटकम्स जे आहेत, लर्निंग आउटकम्स जे आहेत, ते बरेच कमी आहेत. त्याच्यामुळे आज 8वीमध्ये आलेल्या मुलांना तुम्ही 8वीचा करिक्युलम जेव्हा शिकवायला लागणार तेव्हा 7वीचा करिक्युलम ते विसरलेले असणार. अगदी 3 महिन्याच्या मे महिन्याच्या सुट्टीच्या नंतर तेव्हा सुद्धा मुलं जेव्हा शाळेमध्ये येतात तेव्हा शिक्षक म्हणतात त्यांना आधीच्या 8 वर्षाचं काही आठवत नसतं. इथे तर 2 वर्ष मुलं शाळेमध्ये आलेली नाही आहेत. त्यामुळे त्यांना कुठल्या लेवलचं पहिल्यांदा शिकवायला लागेल. नाहीतर सगळेजण आता शिक्षक वगैरे असा फोकस करतायत की 8वीमध्ये आली, 10वीमध्ये आली की त्यांना 10वीच्या परीक्षेसाठी, 9वीच्या परीक्षेसाठी तयार करायचं. पण 9वीचा करिक्युलम घेऊन तुम्ही त्यांना शिकवायला गेलात तर दे विल नॉट बी एबल टू लर्न. आणि द वर्स्ट आउटकम इज द मोस्ट कॉमन रिझन फॉर ड्रॉपिंग फ्रॉम एज्युकेशन ओके इन द स्टेट ऑफ महाराष्ट्र इज डिससॅटिस्फॅक्शन विथ एज्युकेशन. आणि फेल्युअर्स ही आहेत, ती फेल्युअर्स येतात ती बऱ्याच वेळा नंतर मात्र बोट कुठेतरी दुसरं दाखवलं जातं, पॉवर्टी असेल वगैरे. आणि म्हणून प्रायमरी एज्युकेशनसाठी मुलं येतात ती 95% पार्टिसिपेशन मुलांचं असतं. आणि 4थी 5वी नंतर हळूहळू गळती लागायला लागते. ओनली 30 to 40% ऑफ स्टुडंट्स फायनली रीच 9 to 10 स्टँडर्ड. सो हे जर कमी करायचं असेल तर कुठेतरी ह्या 2 वर्षांमध्ये भले मुलांनी फॉर्मल एज्युकेशन केलं नसेल पण घरी राहून काहीतरी इन्फॉर्मली शिकली असतील किंवा ती शिकण्याची संधी पालकांनी निर्माण केली असेल तर त्याचं कुठेतरी ॲप्रिसिएशन हे झालं पाहिजे. म्हणजे मुलांनी गणिताचे पाढे येतात की नाही ते महत्त्वाचं नाही, पण मुलं काय शिकली, काय त्यांनी शिकलं नवीन, त्याच्याबद्दलची माहिती त्यांच्याकडनंच घेतली गेली तर बऱ्याच वेळेला मुलांना शाळेमध्ये यावंसं वाटेल. आणि हे सगळं करण्यासाठी वेळ लागणार आहे. आणि हाच एक्सपिरियन्स आहे तो मिडल ईस्टर्न जो व्हायरस होता, रेस्पिरेटरी व्हायरस होता, तो जेव्हा सब सहारन आफ्रिकेमध्ये आला तेव्हा तिकडे सुद्धा हाच प्रश्न सगळ्यांना जाणवला की शाळा सुरू करायची होती, कारण शाळा सुरू होणं इज नॉट ओनली द कंटिन्युएशन ऑफ एज्युकेशनल प्रोसेस बट प्रॉबब्ली अ मार्कर ऑफ नॉर्मलसी इन द सोसायटी. सो ही नॉर्मल, कारण ही मुलं जर शाळेत नाही आली तर ती कुठे जातात, तर दे नेसेसरीली हॅव कॉन्फ्लिक्ट विथ लॉ. आणि जी कॉन्फ्लिक्ट विथ लॉमध्ये जातात त्याच्यामधने समाजामध्ये अनरेस्ट वाढू शकतो. त्यामुळे गेटिंग स्टुडंट्स बॅक टू स्कूल इज गोइंग टू बी एक्स्ट्रीमली इम्पॉर्टंट. आणि त्याच्यानंतर जर मुलं राहिलीच तर होम एज्युकेशन आहे, होम लर्निंग किंवा ऑनलाईन कंटेंट डिरेक्शन नावाचं नवीन फील्ड कदाचित तयार होऊ शकेल. म्हणूनच तर आता प्रायव्हेट ट्युशन क्लासेस जे आहेत त्याच्यामध्ये मोठी मोठी माणसं मोठे मोठे पैसे घालायला लागलेली आहेत, कारण एज्युकेशन कंटेंट डिलिव्हरी हा देखील खूप महत्त्वाचा विषय ऑनलाईन पोर्टलवरती होणार आहे, विच इज गोइंग टू बी डिफरंट फ्रॉम क्लासरूम डिलिव्हरी.
बर्वे सर, अनम्यूट करा सर.
If any of the audience has some more questions, I would request to quickly ask as we end towards the come towards the end of this session.
Yeah,
if
right. Okay, I just have to make a few points. Number one is that online education is very valid. Like what Ashish said was very valid. I'm surprised that children they're fixated to the video games and activities and chats on the social media and so many places. How is that they don't get glued to education? Because the education is given in the most boring way. Teachers don't know how to handle it. Teachers don't know how to give education class. I have been in touch with the AMRC, which are training. I've attended some classes in IIT where there is separate department how to teach what is e-learning, how to conduct a class, every 15 minutes quiz, how to hold attention, what visual content you give, what auditory content you should be able to, what should go auditory, what should go visual. The huge science, and that has to come to the schools now. Secondly, when children come back from school, they are not going to be maybe happy or unhappy. The family should sit with the children and ask, how was the school experience? Was it frightening? Were you wearing mask? What were your friends saying? What did the teacher do? तुम्हाला काय तुमची hygiene जे maintain करण्याची, what were the सुविधा which was given to you? So all this discussion should take place at home. Then the children who are reluctant to go to school will start going to school, and parents should accept that children have fear of going to school and not just push them.
Thank you, sir, for adding that. Before we wrap up, I would quickly like to say,
Vedhas, just before wrapping up, one quick question to all of the panelists. Dr. Umesh Nagapurkar, he has asked how to encourage our doctor colleagues to seek psychiatric help, especially various psychological disorders and as well as the addictive part. Because we are running this for all physicians and doctors. So each and everybody can answer this, starting from Harish Shetty, Madam, Kumar sir, everybody's opinion, please. We'll take this last question. And
I'll go last.
वेल, एक सर्वात महत्वाचं आपल्या सेशनच्या मध्ये आशिषनी सांगितलं की माइंड बॉडी सेपरेशन आणि हाऊ ही क्लेम दॅट व्हेरी मच आवर सायकोलॉजी इज अ पार्ट ऑफ आवर बॉडी इलनेस अँड एलिमेंट्स. हा सर्वात महत्वाचा मुद्दा आहे आणि हे स्वीकारणं अत्यंत आवश्यक आहे की जसं हरीशने सांगितलं फ्रॅक्चर माइंड, तसं बोन फ्रॅक्चर होतं, तसं कधीतरी माइंड पण फ्रॅक्चर होतं. हे कोणाचंही होऊ शकतं, तुमचं आमचं सर्वांचं होऊ शकतं आणि हा भाग अत्यंत महत्वाचा आहे. आणि जेव्हा अशा प्रकारची अवस्था येते तेव्हा आपण त्या प्रकारच्या तज्ञाकडे जातो आणि आपले उपचार करून घेतो. तेव्हा सायकॅट्रिस्ट जेव्हा अशा प्रकारची परिस्थिती येते तेव्हा सायकॅट्रिस्टकडे जाणं अत्यंत महत्वाचं आहे. ते फायद्याचं सुद्धा आहे. हा भाग नाही की एकदा गोळ्या चालू केल्या की त्या 6-6 महिने ते वर्षभर किंवा आयुष्यभर चालू ठेवायच्या असतात. उलट हा भाग जास्त करून तुमचे जे कार्डिओलॉजिकल इलनेसेस आहेत, काही मेटाबॉलिक डिसऑर्डर्स आहेत, काही एंडोक्रिनॉलॉजिकल डिसऑर्डर्स आहेत, यांच्या बाबत जास्त खरा आहे, आपल्या बाबत तेवढा खरा नाही. दुसरी गोष्ट म्हणजे आपल्याकडे अलाइड थेरपीज भरपूर आहेत आणि त्या अलाइड थेरपीज पण फार इफेक्टिव्ह आहेत. काउन्सिलिंगचे वेगवेगळे प्रकार आहेत आणि ह्यांचा पण उपयोग आपण आपल्या योग्य तज्ज्ञांच्या सहाय्याने करून त्यांना देऊ शकतो. मुद्दा असा आहे की हे पहिल्यांदा स्वीकार करा की आपल्याला कुठेतरी डिस्टर्बन्स होतोय, ज्याचा आपल्या वैयक्तिक जीवनावर परिणाम होतोय, ज्याच्यामुळे आपल्या इंटरपर्सनल रिलेशनशिपवर परिणाम होतोय आणि हा परिणाम आपल्यावर इतका हानिकारक आहे की आपली प्रगती, सामाजिक, कौटुंबिक किंवा वैयक्तिक प्रगती कुठेतरी अडथळून जात आहे. तेव्हा हे एकदा स्वीकारलं आपण तर मात्र पुढील इलाज करणं सोपं जातं. आपल्या डॉक्टरांसाठी जेव्हा आपण आज अशा प्रकारचं वेबिनार घेतलं त्याच्यामध्ये मुद्दाम हाच महत्वाचा होता की अशी त्याच्या संपूर्ण बोलण्यामधनं सतत डोपामाइन म्हणा किंवा इतर न्यूरोकेमिकल्स बोलत होता. हरीश शेट्टी स्टिरॉइड, पॅरासिम्पॅथेटिक अँड सिम्पॅथेटिक सिस्टम सांगत होता. त्याचं कारण हेच की शेवटी देर इज everything is bodily linked, neurologically linked, so you cannot separate mental health from physical. It's definitely a part of our health.
Barve sir.
Okay. I have personally suffered from panic attack. Following 93 blast, 12th March, unforgettable day in my life. I witnessed the blast at Varali. Even if anyone said Varali, I remember those days. Even if anyone say Varali, मैं Varali में रहता हूँ, patient बोला, so I used to have that panic attack. So there was in a public open platform, I have said that I suffered from panic anxiety. I consulted a psychiatrist. He helped me. I went through a process. It has done me very good. So coming out and saying that mental disorders can affect anyone, including psychiatrists, and making no shame, nothing. My TED talk was on burnout in myself. My TEDx talk was on how I burned myself and how mindfulness helped me. So there was a good wave in the audience. They said, "Sir, tumi suddha." I said, "Yes, my body is human body and I experienced it and I have no shame. No, in the talk I've said, I have no shame, no guilt, nothing. I suffered because I'm a human being and I would, as a psychiatrist, I would take one step ahead and say that I did suffer and I've gone through it and it's okay with me." Even with patients, I said, "Arey mala pan dhala hota." So that's okay. So if doctors have this feel, because their exposure to psychiatry, to psychological disorders is all that you see in Hindi films or American movies where they sit and talk and oh, that kind of stuff, or histories which are given in a more horrible way. So I can understand why they feel this way. But I say this is psychiatry when the university is listed as 10th branch in medicine. Baat khatam.
Dr. Deshpande sir. देशपांडे
मी
सर
बोलू का?
या बोला.
मला असं वाटतं की आपल्या शरीरातल्या जर एका सिस्टीमबद्दल आपण सतत अवेअर असू तर ते आपलं मन असतं. हार्टमध्ये दुखायला लागलं की आपण हार्टबद्दल अवेअर होतो. पोटामध्ये ॲसिडिटी झाली का आपण पोटाबद्दल अवेअर होतो. आणि ह्या कारणामुळे आपण सगळेच, म्हणजे वेदर यू आर अ मेंटल हेल्थ प्रोफेशनल, यू आर नॉट अ मेंटल हेल्थ प्रोफेशनल, यू फील दॅट यू आर अवेअर ऑफ द माइंड अँड द फंक्शनिंग ऑफ द माइंड. आणि जेव्हा तसं होतं ना तेव्हा एव्हरीबडी बिकम्स अन एक्सपर्ट. सो कुठेतरी सगळ्यांना कळलं पाहिजे की एक्सपर्ट इज बरोबर. म्हणजे पूर्वी जे आहे तेच, म्हणजे तुम्हाला माहिती असेल की सर्जन्स जे होते ते अजूनही UK मध्ये डॉक्टर ही पदवी लावत नाहीत. याचं कारण असं होतं की फिजिशियन्स नेव्हर कन्सिडर्ड देम एज डॉक्टर्स बिकॉज ॲज द ओल्ड सेईंग सेज दॅट they don't know anything and they land up doing everything. Physicians are the ones who do everything and they don't know anything. And pathologists are the ones who know everything but it's too late, and psychiatrists are the ones who don't know anything and who don't do anything. असं एक डिक्टम होतं. पण आता परिस्थिती बदललेली आहे. 1940 onwards there have been lot of changes. There are lots of understandings of the neurosciences that have worked. Yes, The science is in the infant stage. I would say that neonatal stage. But that doesn't mean that it's not able to give solutions. Most of the solutions that are on offer are probably better equipped for mental health than what philosophy can offer or religion can offer. So that is something that we need to accept as a fact. आणि ते एकदा ऍक्सेप्ट केलं की मग आणि दॅट ॲक्सेप्टन्स विल हॅपन व्हेरी स्लोली. LGBTQ असू दे किंवा ड्रग ॲडिक्शन ॲज अ डिसीज असू दे, द ॲक्सेप्टन्स ग्रॅज्युअली माउंटेड. Finally, Satchidananda, that is something which is extremely important. The real truth will always survive. So that brain sciences are the cause of all mental ills is something that will survive. Whether you accept it now or later, earlier you accept it, better it would be.
Dr. Thatte, madam?
So, as other people have said, I will also insist on that acceptance. Acceptance that I am a human being and I can suffer from anything. आपल्या लक्षात येतं की जेव्हा पेशंट आमच्याकडे येतो, आपल्याकडे त्याला त्याच्या मुलीला झालेला स्किझोफ्रेनिया किंवा आजार सांगतो, तेव्हा त्याचं पहिलं वाक्य असतं की आमच्या घरात कोणाला होणं शक्यच नाही. म्हणजे आमच्या घरात कोणाला होणं शक्य नाही याचाच अर्थ काय की असे तऱ्हेचे आजार हे फक्त दुसऱ्याला होतात, आम्हाला होत नाही. हाच ऍटिट्यूड पहिल्यांदा बदलला पाहिजे की मी ह्युमन बिंग आहे, मला काही होऊ शकतो. त्यामुळे त्यांनी मदतीसाठी त्यांना उलट हे माहिती पाहिजे की मला मदत मिळू शकते. जेव्हा माणूस असं म्हणतो की आमच्या घरी कोणालाच होत नाही, तेव्हा त्यांच्या मनात हे असतं की ह्याला काही हे लोक कोणी बरं नाही करू शकत. पण जे मेडिकल प्रोफेशनल्स आहेत त्यांना माहिती असतं की याच्यासाठी औषध आहेत, त्यासाठी उपाय आहेत आणि अर्लियर द बेटर. त्यापुढे उपायासाठी लवकर जर आले आणि त्यांना बाकीच्या विषयाच्या त्यांच्या नॉलेजमुळे उलट ते जास्त लवकर बाहेर येऊ शकतील, अगदी ज्याला काहीही माहिती नाही त्या विषयाची त्याच्यापेक्षा. त्यामुळे मदतीसाठी पुढे येणं त्याच्यामधला पहिला भाग ऍक्सेप्टन्स आहे. तो ऍक्सेप्टन्स प्रत्येक माणसाचं आपल्याला झालं तर तो ऍक्सेप्टन्स कमी असतो. त्यामुळे तो कमी असणारच आहे, पण त्याच्यावरती मात केली तर ते मदतीसाठी येऊ शकते.
Thank you, madam. Dr. Harish Shetty, sir.
We have to be mental health missionaries. Simple. We have to be creative in our marketing. No excuses. I'm not going to wait for hundreds of years. He said it's pre-infancy. No, I want to see change in my lifetime. Mental health missionaries, be creative, effective data sharing. 1 out of 7 people are mentally ill. 1/3 people who die of suicides are because of family problems. 4th is our ambassadors. The head of pediatrics, JJ Hospital, is shouting out every day that I take clonazepam for panic even today, and she's ready to come on any platform and say that everybody should take it. So find ambassadors among physicians who are under treatment. Let them tell the world, because we need allies to tell them. 4th is when people come to you, what happens? People quietly come to you with the children, the mothers and the fathers. Appointment देना, थोड़ा last का देना. क्लिनिक में नहीं आएगा और किधर आऊं क्या? तू मेरे आएगा क्या घर पे? त्यांना सांगायचं आफ्टर द इलाज you have to talk on mental health. Make ambassadors to talk. Disclosure improves. Lastly, evolution has to start from the top. Revolution starts from the bottom. And evolution would mean mental health camp बिंदास करायचं आणि see that physicians आपले जे ambassadors आहेत त्यांना आपण पटवलंय, whom we have converted, त्यांना चेकअप साठी ओपनली आता कोण आलेत? हेड ऑफ द डिपार्टमेंट ऑफ मेडिसिन फ्रॉम ज्युपिटर has come for a mental health checkup. असा स्प्लॅश करणं आणि being intelligent and creative. आणि एकेकाला झाला एक्सेप्ट करायला आपलं केलं तर चालेल, आपल्या आयुष्यात काय होणारच नाही राजेंद्र. सो अपने को घुसने का और एसर्टिव भी रहने का, कभी कभी बहुत एसर्टिव रहने. When somebody tells me a patient who's got CAT scans and some neurologist says it is NMDA receptor encephalitis, I put my foot down and say I want to give you CTs. Yes, kuch nahi hai. I mean, you have to be assertive. Unfortunately, our science makes us very humble. Our experience actually makes us very humble. See the annual conferences. you'll understand the difference between professions. फिजिशियन का कॉन्फ्रेंस चकाचक 3 पीस सूट, कार्डियोलॉजी का 5 पीस सूट, साइकेट्री का बहुत कम पब्लिक सूट पहनता है, एनेस्थीसिया एंड साइकेट्री कॉन्फ्रेंस में सिंपल कपड़ा पहनता है. क्यों? द प्रोफेशन इज एन हम्बलिंग प्रोफेशन. पर अपन ऐसा हम्बल रह के कुछ होने वाला नहीं. वी आर मेंटल मिशनरीज. नागालैंड में 5 क्रिश्चियन मिशनरी गया, 5 को मार डाला, फिर और 5 गया. आज अक्का नागालैंड क्रिश्चियन है. Full Nagaland is Christian. So that is the attitude we have to have. That attitude should be trained while doing their MD and DNP. असं तुम्ही प्रवचन द्या, वासुदेव पुरंदरे हॉलमध्ये 100 फीसचं प्रवचन द्या, ते म्हटलं नाही होणार. ते सगळं घुसा, कमांडो बना. आलं लक्षात ना? थँक्यू.
Thank you so much, sir. That is a good message. Commando bana, and we should be a little assertive at times. I would like to thank Dr. Nagapurkar sir for bringing up this wonderful question.
Thank you, Umesh.
Before we go, I have something to say. As a physician, we have come up with these red flags. We tell all our patients like fever, so and so, cough, so and so for so many days, happy hypoxia, all those signs. We all are aware of it. As we have been discussing since morning, we cannot really separate the mental health and physical health because the mind is very much part of our body. So why there are no red flags for the
है ना बाबा, है ना, सब कुछ है.
Yes, so that has to be spread more. I would like to request here on this platform, each one of you, each speaker, 6 of us, please tell our audience, to our doctors, because educators become educators. When we teach doctors, they teach their patients. So tell one red flag from the mental health aspect. We'll start off with Thatte madam, which has to be seen in every single patient, and if found, has to be reported, just as we report the fever and other red flags. Thatte madam, please, एक red flag तुम्ही काय सांगाल?
युजली आम्ही काय सांगतो की IPPI. आय म्हणजे काय की तुम्हाला थोडा तरी डिस्ट्रेस येतो कशातरी, पण तुम्हाला जेव्हा दिसेल की तो डिस्ट्रेस, if it is affecting your interpersonal relationship. Second is if it is so intense that you have difficulty focusing. Third is P म्हणजे whether it is all pervading. जे तुम्ही जे काम करता ते सोडून कुठली गोष्ट करताना तो विचार तुमच्या डोक्यातनं जातच नाहीये. आणि नंतरचं P म्हणजे पर्कोलेटी, पोखरत जाते तुमच्या मनाला आतपर्यंत. तर अशी जेव्हा अवस्था होईल तेव्हा फर्स्ट स्टेप विल बी की तुमचा तो त्रासदायक विषय तुम्ही कोणाशी तरी बोला, कोणाशी शेअर करून जर बरं वाटत असेल आणि यू फील ओके, इट्स ओके, पण तुमच्या लक्षात त्याला शेअर करून बरा होत नाहीये, तर यू हॅव टू मीट मेंटल हेल्थ प्रोफेशनल. तर दीज आर सिंपल IIPP. ते लक्षात ठेवले तरी मला होणारा त्रास कमी करण्यासाठी मला मदत पाहिजे आणि ती मला ताबडतोब मिळवली पाहिजे. हा एक आम्ही युजली सांगतो.
Thank you, madam. So we have first IIPI. Dr. Harish Shetty, sir.
Anhedonia, inability to experience joy or sadness. मेरे को किसी को देख के खुश एक ही एनीडोनिया, और सब लोग एक बोलेगा ना.
Dr. Shailesh.
Inability to experience joy or sadness.
Dr. Shailesh. Dr. Shailesh, unmute yourself, please. Yeah.
If you're feeling many of the, as Barve sir was saying,
Alka,
just 1 minute. Yeah, 1 minute.
There seems to be a little problem with his audio visuals.
Yes, some problem.
Yeah, we can hear you. You please continue.
Can you hear me now?
Yes, we can hear you. Please continue.
Okay. As Barve sir was saying it, sometimes the emotional disturbances, and because of that, if you are thinking there is fatigue in the practice, especially for doctors, मजा नहीं आ रहा है, ये नहीं हो रहा है. So talk to somebody, talk to your psychiatrist friend. That's very important, and keep a psychiatrist as a friend always.
Yes. Dr. Barve, sir.
Yeah, when you wake up in the morning, do you look forward to the day? अरे आज का दिन आया, अभी आज ये करेगा, वो करेगा. That kind of feeling that you get up in the morning, you have that feeling, I am looking forward to the day. If that stops, you are not looking forward to the day. And if you're not looking forward to the day, you're not looking forward to life. So that's
Yes,
very important. You
very
need to
well
work
said.
on it.
Dr. Ashish Deshpande, sir.
मला वाटतं आपल्याला जी काही सजेशन्स मिळत आहेत ती अँझायटी आणि डिप्रेशन ह्या दोन आजारांबद्दल मिळत आहेत. आणि असे बरेच आजार आहेत की ज्याच्यामध्ये मूड सुद्धा चांगला असतो. कारण मेनिया असेल तर तो माणूस अगदी मजेत असतो, तो तुम्हाला सांगणार नाही की मला काही वाईट प्रॉब्लेम्स आहेत वगैरे. किंवा फॉर इन्स्टन्स सबस्टन्स यूज ऑल्सो. सो इट इज व्हेरी डिफिकल्ट टू हॅव वन पॉईंट रेड फ्लॅग इवन फॉर फिजिकल हेल्थ. म्हणजे तुमच्याकडे आलं तर तुम्ही एक सिम्पटम कुठचा विचारून कार्डिओव्हॅस्क्युलर, GI सिस्टीम, डर्मॅटॉलॉजी याचा प्रश्न विचारू शकत नाही. So the red flagging is separate for each and every disease if you have to really probe into it. आणि त्याच्यासाठी एक मी जे माझ्या प्रेझेंटेशनमध्ये तुम्हाला सांगितलं की DIGIShield कनेक्ट म्हणून जो प्रोग्राम आहे त्याच्यामध्ये द फर्स्ट लेव्हल ऑफ ट्रेनिंग इज अबाउट दॅट तुम्ही अर्ली स्टेजमध्ये ॲडिक्शन कसं आयडेंटिफाय करू शकता आणि तुम्ही आयडेंटिफाय केल्यानंतर त्याला लवकरात लवकर नॉलेजेबल ट्रीटमेंट रिसोर्सकडे कसं पाठवू शकता. सो स्क्रीनिंग अँड ब्रीफ इंटरव्हेन्शन अँड रेफरन्स थेरपी आणि अर्ली डिटेक्शन. सो आणि हे जे आहे ते हेल्थकेअर प्रोफेशनल्ससाठी मुद्दामून डिझाईन केलेलं आहे. सो अशा प्रकारचे प्रयत्न जास्तीत जास्त मेंटल हेल्थमध्ये झाले पाहिजेत आणि तसे करण्याचा प्रयत्न झाला पाहिजे. पण मला असं वाटतं की एखादा सिम्पटम किंवा 2 सिम्पटम्सवरती करणं, you would be just probably scraping the surface.
Absolutely. Dr. Kumawat sir.
मगाशी मी म्हणालो की आपल्याला आत्मभान असणं स्वतःचं आपल्या सामाजिक, कौटुंबिक, वैयक्तिक किंवा शारीरिक जीवनात किंवा इंटरपर्सनल रिलेशनशिप मध्ये कुठे कोणत्याही प्रकारची अडचण निर्माण होते, काही इतरांनी आपल्या निदर्शनास आणून दिलेली आहे, तर या जीवनाच्या आपल्या विविध अंगांमध्ये जर काहीही अडचण आपल्या किंवा इतरांच्या नजरेत आली तर त्याची नोंद घेऊन त्या दृष्टीने कुठे नेमकं अडलंय, कशामुळे अडलंय याचं तज्ज्ञांतर्फे मार्गदर्शन घेणं अत्यंत आवश्यक आहे. हे मला सर्वांना होऊ शकतं, तेव्हा आपण सर्वांनी हे स्वीकार करणार की हे होऊ शकतं.
Yes. Dr. Amol Bhusare, you wanted to add something?
Yes, sir. सर सायकॅट्रीमध्ये रेड फ्लॅग साईन म्हणजे जर आम्हाला सांगायचं म्हणलं तर मी असं सांगेल की आमच्याकडे प्री मॉर्बिड पर्सनॅलिटी म्हणतो आपण. आजारी पडायच्या अगोदरची एखाद्याची जी पर्सनॅलिटी आहे त्याच्यामध्ये जर कन्सिस्टंट काही लॉंग ड्युरेशन किंवा समटाईम ड्युरेशन साठी जर चेंज असेल तर निश्चित आपण कुणाकडे तरी जाऊन किंवा आपल्याला सायकॅट्रिस्ट हेल्प घेण्याची गरज आहे. आपल्या हिस्ट्री टेकिंग मध्ये जर आपण विचारलं की पर्सनॅलिटीमध्ये काही मेजर चेंज आहे का, उदाहरणार्थ जेव्हा आम्ही सेशन घेतो तेव्हा आम्ही असं सांगतो सर की सायकॅट्री म्हणजे नेमकं काय, तर इमोशन्स म्हणजे भावना, थॉट म्हणजे विचार आणि थर्ड म्हणजे बिहेवियर. माणसाच्या इमोशन्स आणि भावनांमध्ये, विचार आणि भावनांमध्ये जर गोंधळ झाला आणि त्याच्यामध्ये ऑब्जेक्टिव्हली बिहेवियर मध्ये जर फरक होत असेल तर हा बिहेवियर जेव्हा रिलेटिव्हला किंवा इतर लोकांना नोटीस होतो त्यावेळेस एक प्रकारचं रेड फ्लॅग साईन समजून आपण सायकॅट्रिस्टला कन्सल्ट केलं पाहिजे.
Very well said. So the message here is loud and clear for all of us as the healthcare professionals. Look for anhedonia, the inability to feel happy. Really ask your patients and even family members or whoever, do we really look forward to the day? Like Dr. Shailesh said, always have a psychiatrist friend on hand. And like Dr. Ashish Deshpande sir and Kumawat sir said, with just 1 or 2 signs or 1 or 2 questions here and there is just perhaps scratching on the surface. So if we find, we as doctors basically do understand, even non psychiatrists also do understand that there seems to be some kind of problem with this patient. Please do not hold back and refer to the right mental health care professional. So that is the message here. With that, on that note, I would like to thank team DIGIShield and Mr. Dipen Mehta, the CEO of DIGIShield, for organizing this wonderful program for us. Doctors, they have been doing it since last 2 years. I have myself done more than 25-30 programs on vaccination, which I do as a physician. But I have loved doing this program today with all you mental health care professionals. I would like to also thank Piyush, who's a technical support person who has patiently been taking our queries since past 2 years and helping us, and everyone else at DIGIShield. And I would like to thank the man of today, I would say, Dr. Shailesh Umate, the organizing chair of today's program, who has brought together these wonderful speakers and arranged this program. I would like to request Mr. Dipen Mehta of DigiShield to present a virtual memento and token of appreciation to Dr. Shailesh Umate. He truly deserves
Thank
it.
you. Thank you. Some problem with my video. I am not able to start my video.
Yes, but we can hear you well. Dipen, आप अगर please
Yes.
इनको एक trophy दे दें.
Piyush, can you please share the remaining mementos, please?
Yes, we have already
Even
given
for
away the
Dr. Vedhas
mementos
we have.
to chairpersons. I would like to thank once again, starting from Dr. Ashish Deshpande, Dr. Harish Shetty sir, Dr. Rajendra Barve sir, Dr. Sanjay Kumawat sir, Dr. Shubha Thatte madam, Dr. Umate sir, and our esteemed chairpersons, Dr. Nilesh Basarkar, Dr. Omkar Mate, Dr. Anaga Vaze ma'am, Dr. Amol Bhusare sir, and Dr. Prasad Shetty sir. It was wonderful. And last but not least, I would like to thank our audience who have been the motivation for us. This whole idea was born out of my mind because in my lectures, when I take vaccine master classes, I often get questions from the doctors who were audience that why not we do something related to mental health. And that's where this idea came, and we had this wonderful program today. Thank you very much. Dr. Mr. Dipen, आप कुछ please share करिए.
Yes,
Mr.
yes.
Dipen.
Piyush, first of all, thank you, Dr. Vedhas Nimkar, for your such a nice coordination and getting connected DigiShield with such eminent speakers. We would like to have a token of appreciation for Dr. Vedhas Nimkar as well. Piyush, can you please share a moment of Dr. Vedhas Nimkar? Please accept our token of appreciation. As we are moving currently with the online and virtual platform, so now there is a e-mementos for a digital memento, we can say. And thanks a lot to all the speakers and participants. And we can see like till end, we have like 70 to 80 attendees till the end who are listening and sharing their views and questions as well. Thanks to all the speakers and Dr. Vedhas Nimkar, a special thanks that connecting DigiShield and giving us opportunity to connect with the expert speakers.
Thank you, delegates. Please keep sharing your feedback with each one of us. It motivates us to do more such wonderful programs. And I'm sure we as an extended family, we are going to conduct more of these programs, maybe digitally during the pandemics and at a later stage physically also. Thank you very much. Dr. Shailesh Umate, sir, if you could give vote of thanks, please.
Thank you so much. I thank all the speakers, Dr. Harish Shetty sir, Barve sir, Ashish Deshpande sir, who had delivered a wonderful lecture here. Thank you, Kumawat sir, for being one of the panelists and giving us wonderful insights. Shubha Thatte madam, thank you so much. You are the kind of lovely mother to all of us young budding psychiatrists. And I'm sure she was kind of there in KM where all these today's speakers were doing their residency, if I'm correct. All these people were doing residency. I think Barve sir did it from Sion, but rest of them were from KM. So thank you so much, madam. So first name that popped up in my mind was you regarding this. Thank you, madam. Anaga, thank you so much for being here, chairing this session. Amol, thank you so much. Harish Shetty sir, Nilesh Basarkar, thank you so much. Prasad Shetty sir, thank you so much. And Nimkar, thank you so much for interacting about this and coming up with this wonderful session. And DigiShield, thank you so much for providing us a platform for free of cost. And we can come up with some wonderful ideas in future. Hopefully you will kind of sponsor us. Thank you so much, DigiShield. Thank you, Piyush.
Thank you.
Thanks all. And thanks all the audience and participants who had asked us wonderful questions. And 3 घंटा कैसे निकल गया पता ही नहीं चला है. Thank you. Thanks a lot. I think with this, I declare that this program has ended. Thank you. And thank you so much.
Thank you, sir.
Yeah.